seen Bill yet.
Our sister's older or younger than him.
All right. At last, sorry for the technical issues there. I was listening a little bit earlier. Are all 11 of the council members on board? Looks like it. Chris, anything before we start that you need to say?
I think my comments will come along with tonight's COVID-19 update.
Started then. I will gavel us, call us to order then. Welcome everyone. This is October 5th, 2020. This is the Billings City Council work session. Work session doesn't mean that we don't work on our other weeks off. It just means that this is not our formal business meeting. It's a little more informal in our procedures. There will be an opportunity for the public to comment after each one of the 4 items on our agenda tonight, which are first a COVID-19 update, second, our Complete Streets Progress Report, third, a CARES Act update, and fourth, general discussion about expectations between City Council and staff. I do welcome everybody here. Our first item up is our COVID-19 update by our County Health Officer, John Felton. Before we jump into that, I see John's with us. I'd like to make some introductory comments because there's been a lot of attention in the paper recently on our COVID-19 situation. And I just want to encourage us all to take heed of what we're going to hear from John. About 3 hours ago, he held a press conference and made some important announcements that have been agreed upon, not just by Riverstone Health, his office, but our hospitals and other healthcare professionals. It's important that we listen to their professional judgment. My purpose in making these comments is to express my personal support for these measures. I know I cannot speak for the City Council. We haven't taken any formal action there. So these are my personal beliefs, but I also do want to remind the community that in no uncertain terms that we must do better or that we will suffer more deaths, more stress on our healthcare system, and more economic disruption from the disease and potentially from stricter healthcare orders. And we should not fool ourselves. Although our numbers are better than a few smaller counties in Montana, compared to the other 6 counties with major cities, Yellowstone County's cumulative death rate and infection rates since the outbreak of the pandemic are by far the worst. In very round numbers, our death rate is almost double the next closest county and 14 times the county, the large county with a large city with the very lowest rate. Our infection rate is about 1.8 times the next highest county with a large city and 4.3 times the county with the lowest infection rate. Every one of us must take personal responsibility to bring these numbers down, and we must expect that other persons and businesses will do the same. If businesses decide to intentionally disregard the law, we should expect our political leaders and our law enforcement community to hold them responsible for their actions. Finally, I would encourage individuals who have been impacted by the coronavirus to tell their stories, if they're willing to do so, with the media, so the rest of us can learn from their experience. Healthcare providers are legally obligated to protect the privacy of their patients. So it's up to individuals to take the initiative and reach out to their local newspaper or other media outlet if they wish to do so. So thank you. And with that, I'll turn it over to our County Health Officer, John Felton, for his report. John, welcome.
Thank you. It's good to see everyone again. So what I wanted to do today is kind of bring you up to speed on where we are and share some of our data with you. The stuff I'm going to share with you is publicly available. It's easy to find. So I'm going to share my screen here, if all goes well. And do you see the state map there now?
We do.
Okay, so this is today's update. So, and I think we got to make sure we understand what this is really showing. So these are tests that were run yesterday. So most of these tests would have been collected Friday and Saturday, run yesterday. So this is really the Sunday numbers for tests collected Saturday. Tomorrow we'll get Monday numbers for tests collected Sunday. That's why Monday and Tuesday are typically our lower days. So as we look at this, I just want to point out some things. Oops, there we go. So this is, these are total cases to date. And this, oops, I can make my thing work here. Well, maybe I can't. I'm having mouse issues.
We can see your cursor. It's a little round ball.
Yeah, I'm not sure why that is. Oh, well, I guess it's not going to cooperate with me.
It's like a scroll mode.
It is, and I'm telling it not to do that. But let me just talk a little bit here, and I can change screens, I think. Let's see if I can change it here. So this looks at the cases over the, going all the way back to the early cases in March. And you see this nice period here in April, May, and June where it's pretty low. And then we kind of went up, we went down, and now we're back up again. Here we go. Now we got it back. So these are our cases that were reported from yesterday. So Yellowstone County 34, Roosevelt 33. The mayor mentioned that when we look at these numbers, we need to take some account for population. And I think this is important. And please understand, you will never hear me say that our large numbers don't matter. They do matter. But they are a little bit out of context when you look at just the raw numbers. So I did a little math for everybody. This is our 34 cases. Roosevelt County had 33 cases yesterday. The equivalent of Roosevelt County's 33 cases when we account for population would be 484 cases in Yellowstone County. Cascades 32 is the equivalent of 63 cases here. Deer Lodge County's 20 is the equivalent of 353 cases. Lewis and Clark had 11. That is lower than ours, so that would be the equivalent of 26 cases here. And we had 34. Bighorn County's 9 is the equivalent of 109 in Yellowstone County. And Pend Oreille County is just 6 cases, but the equivalent of that is 164. What's really critical is when we look at these active cases, pretty much everything in this area is potentially ours because of our regional reach. So Roosevelt County, 238 cases. This is Richland County, 67 active cases. Rosebud, 121. We have 157 in Bighorn. I would point out that one, not that one is anything impressive, but that was Petroleum County is the last county in Montana to get a case. So now every county in Montana has had at least one case. So nothing to brag about. We've seen our hospitalizations increase over time. Now up over 200 active hospitalizations. This morning there were 96 hospitalizations in Yellowstone County, of which 45% of those patients were Yellowstone County residents and 55% were out-of-county residents. So that's kind of just sort of where we are. I want to go over and share this with you. This is called COVID Act Now, and this is a website that collects lots of data and has these regular updates. So this is Montana. You can see it 34.9 cases per 100,000. That's a dangerous number of new cases. That's, we try to keep it below 25. We're clearly not there. This infection rate means that for every one person who's infected, they infect 1.24 people. As long as that number is greater than 1, the epidemic will grow. When it's less than 1, it starts to reduce. Test positivity rate, this is statewide, 9.3%. We'd like to see that under 5. This is a little bit of a difficult number because ICU space is highly variable. It depends on staffing. It depends on can we expand the ICU service or not. So that's not a particularly useful number, especially in a state like ours. And this, look here, this tracers hired. If we come down to where that number shows up, let me get down here a little bit. So this is with 373 new daily cases on average. Montana needs an estimated 1,865 contact tracers to trace each new case within 48 hours of detection. We are nowhere near that. So that is an issue, and we will talk about the fact that our time to trace is slowing down. This is Yellowstone County. Yellowstone County is big enough to get its own space on COVID Act now. So we're about the same levels. This is what we've said, 36 cases per 100,000 over the last week. Our infection rate is a little bit lower than the state, which makes sense when you realize that although we are growing cases, we're growing them at a slower rate than the rest of the state. And I've got some data that makes that pretty obvious. And ICU headroom. This is, again, we should never discount the fact that we have a lot of cases. But when you start correcting for population, you'll see that Yellowstone County is 22nd out of 56 counties. These smaller ones, it's true that they have a significant impact of a few cases, but bear in mind that also in those counties, the resources are substantially smaller. So when we have these counties in eastern Montana that are seeing a high number of patients relative to their population, we would see that many of those patients will arrive here. So now let's jump over here. Let's look at the Yellowstone County dashboard. This was actually updated today to show that the healthcare system capacity has turned red. Our hospitals, as we've heard numerous times, are very busy. They're certainly not turning anybody away, but they're very full. When you have, at this time of year, our hospitals tend to be fairly full anyway. And when you add nearly 100 COVID-19 patients on top of all the other patients that they're normally seeing, that is a significant burden on our healthcare system. We've been at red for health department in case investigation capacity for a while. And I think I've told you all before, we've hired about twice as many employees in the last 3 months as we typically hire in a year. Most of those are doing case investigation, contact tracing, and testing. But they are, we just can't keep up. There's just too many cases, too many people don't answer the phone. So we really need people to, if they get told that they're positive, they're also given isolation instructions. They're given instructions on how to identify who's a close contact and needs to be quarantined. And we encourage people to isolate themselves and notify their close contacts. Testing capacity, we're still able to test all symptomatic people and close contacts who seek testing and get results back in a timely manner, but it's starting to stress the system. Disease surveillance, I'll explain that in a minute. The regional impact is significant. As you've seen eastern Montana, you've seen North Dakota today set a new record for the number of hospitalized patients. South Dakota has had a lot of cases. Wyoming has been a little more stable, but it's also significant. And this is our daily average of COVID-19 cases for a week on a weekly basis. That's a 7-day number, Sunday through Saturday. 32 was last week, or was the week. This is updated on last week. So the update that will come tomorrow will show that at 36 per 100,000. And our test positivity rate, this is the number that comes from the state health department every Tuesday for the previous Sunday through Saturday week. Was at 8% last week, and we don't know what it'll be this week, but we'll get that number tomorrow. Then the last thing I want to share here before we start, just visit about this These are our new numbers, our new charts that are up on our website. This, again, will be updated tomorrow. So let's kind of walk through this. This is, let me just share this. MMWR means Morbidity and Mortality Weekly Report. That is a report that comes out every week from the CDC. They number all the weeks from 1 to 52 from a Sunday to a Saturday. So these are all weeks ending on Saturday. There's the most recent one. This, again, will be updated tomorrow for the weekend at October 3rd. So you can see what the distribution of ages is. Our biggest group is that 20 to 39 group, which is pretty typical. The red line shows you the percent of cases that are 0 to 19 years of age. The reason that's important is for schools. That's our school age population. This next chart breaks down that school age population. So not surprisingly, you see the biggest group is high school students. This last week was middle school, and then younger students after that. That does shift around a little bit. This is new cases per 100,000. So the brownish tan bars are the daily number of new cases per 100,000. What's in orange, the circles, is the week number for the week ending on that Saturday. You can see we kind of worked our way down, then we've come up, and again, next week this will read 36. The yellow bar is 10 per 100,000, so less than 10 is green status, 10 to 25 is yellow status, and above 25 is red status. So we're up above that. This is our test positivity rate. Again, this comes from the State Health Department each week. So below 5% is green status, 5 to 10% is yellow status, and above 10% is red status. The bars show you the number. So last week, the orange bar is the number of positive tests, and the bluish bar is the number of total tests. So we had about 4,313 tests last week. We had 344 that were positive, and that is about 8%. These test numbers relate to the number of cases in Yellowstone County residents. So no matter if someone gets tested, an out-of-county person gets tested in Yellowstone County, this doesn't count them. It only counts Yellowstone County residents. This is a chart that is getting becoming an increasing concern to us. When you see this update tomorrow, it'll be significant. So this is our hospitalization. This is the burden on our two local hospitals. The blue bar is the number of inpatients with COVID-19 in med-surg beds. The orange bar is the number of COVID-19 patients who are in the ICU but not on ventilators. And the red bar is the number of patients in ICU who are on ventilators. So this would tell you, like for last week, we had 14, on Saturday, we had 14 ICU patients, 4 of whom were not on ventilators and 10 of whom were on ventilators. This last week goes up significantly. We hit 90 last week, and we hit 96 today. So these numbers are a significant source of concern. Again, these are all patients in our hospitals, regardless of where they live, because the burden on the hospital isn't related to where they live. The numbers that are in the sort of pink circles are the number of deaths that week. That is only Yellowstone County residents on the death number. And then this last one is emergency department surveillance. What this looks at is a case definition of fever or chills and at least one other symptom from cough, difficulty breathing, or shortness of breath. This information has been collected for many years by the State Health Department. So what we've got here is the blue bar is 2018 on the same MMWR week. The green bar is the number for 2019. So when you look at those, this is the percent of emergency department visits each week that meet that case definition. 18 and 19 are very, very similar. This is 2020. So you see a difference of 2 to 5-fold increase in patients that meet that case definition, fever, chills, and at least one of cough, difficulty breathing, or shortness of breath. So it's a significant difference. So we're seeing significantly more respiratory type disease in 2020. Now, bear in mind that we are not yet to influenza season. someone asked the question about influenza. I'll talk about that in a minute. But these numbers historically go significantly up in influenza season. So the concern this year is we're going to have influenza and probably COVID. One last thing I want to show you. These are some charts that I keep. So this is Montana cases by day. You can see the significant increase over the last 2-week period. Yellowstone County has also increased, not at the same rate. And what that will show you, the orange is the 7-day average, the blue bar is the individual day. But what you'll see is this is the Yellowstone County's share of Montana cases by day. So again, the blue bar is each daily count, and the orange line is the 7-day average. This is actually down at about 16% now on a 7-day average, which is our proportionate population share. So again, you'll never hear me say that we shouldn't worry about the number of cases we have. What I'm telling you is our experience is now pretty proportionate to the rest of the state. And this really shows it. So this yellow bar is our 7-day case average. The blue line, sorry, orange line. The blue line is Montana's 7-day average. And this gray line is our proportionate share. So again, you can see that we've been as high as at more than 40% of all the cases in the state when you go back here to early July. And right now we're proportionate roughly to our population. Again, that doesn't mean we shouldn't worry about our cases, but it does show what's really going on in the rest of the state quite clearly. That's case for 1,000. We can move past that. This is the other piece I wanted to share with you. This is the proportion of cases less than 19 years old, or less than or equal to 19 years old. The reason this is important is this is our school population. So this is the proportion since the inception. These two missing data points are where the state's website reporting had a real hiccup. But it's all corrected now. So you can see that we're a shade under 12%. We've been between 10 and 12% pretty steadily. And then this looks at on a weekly basis. This is really important for our schools because this helps us understand what are we seeing in terms of overall school burden. And so here's where school started. It went up, it came down, it went up, and now it's worked its way down for the last several weeks. So yes, we do have cases in schools. We've got some instances where there's multiple cases in schools that are all being investigated right now. But we're not seeing a really large proportion of cases coming out of our schools. So with that, I will stop sharing. And just, so let's talk about what I said today in our press conference. I spent a lot of time working with the Unified Health Command medical technical team. That medical technical team is composed of physicians and nurses, physicians who do primary care, as well as the infectious disease experts in our community, public health nurses, and infection prevention and control nurses. There are many, many years of experience in that group. So I've been working with them. We also have been meeting with the administrative leadership of the hospitals. The concern is really the burden on our community. It is just overwhelming. Public health is having a difficult time keeping up with case investigation and contact tracing. Again, notwithstanding all the people we've hired, there's just too many cases that come in too fast. Our hospitals, again, we're at 96 patients today. Our two hospitals don't get too excited about the specific. It's somewhere around 200 or 500 beds total. I don't know what the exact number is. That's a ballpark. But when you add almost 100 patients to 500 beds, that means that that's 20% of all the beds available are being filled by this new disease. When in fact we're still seeing all the things we normally see, traumas and heart attacks and strokes and injuries and surgeries and all the things that are a normal part of life. And now we have this additional burden. So what we said today, we shared the data with the public. And the point that we're at is this is not sustainable. We cannot continue to see the increases we're seeing and manage the population of patients and the public health burden. So what I announced today is that really I've said this many times, that this is fundamentally a disease that's transmitted by human behavior choices. We all know how to slow down the transmission of COVID-19. Number one, you maintain your distance. Number two, you wear your mask. Number three, you're vigilant about hand hygiene and cleaning and sanitizing surfaces. Number four, if you're sick, you stay away from other people. That's what it takes. There is no definitive treatment for COVID-19. There is no vaccine at this point for COVID-19. Prevention is what we have. And quite frankly, it's not very hard to do those things, but people are tired of them. People just don't want to do it anymore. We don't have good mask compliance. We have too many people that are getting in large groups and getting together. What we also know, though, is if everyone magically today started complying with all those things and just 100% compliance with masking and distancing and hygiene and sanitizing and staying home when they're sick, we're still going to see a number of cases for the next 2 weeks because they're kind of baked in, right? Those exposures have already happened. What we need to do is stop the exposure rate going forward. So if we imposed restrictions today, you wouldn't see the impact for several weeks. And that just really kind of makes people feel like, well, see, I told you it didn't work. You put these restrictions in place and nothing happened. So what we said today is we have set a specific target date and a specific target number. So as I showed you, we look at the cases per 100,000 over a 7-day period starting Sundays and ending Saturdays. So our target date is the 7-day period ending Saturday, October 31st. If we are under 40 cases per 100,000 per day over that 7-day period, when we get to October 31st, no additional restrictions will be put in place. If we're over that number, then there will be additional restrictions, and that will include limiting group size to 25, regardless of ability to physically distance. Schools do have an exception to that because they have their own plans. It will include limiting restaurants and bars and casinos to 25% of their capacity. And it will require bars or any place that serves alcohol to close at by 10 p.m. And it will require churches to not have more than 25% of their capacity. Nobody wants that to happen, but we cannot continue this ongoing increase in cases. Our public health and health system resources simply are not inexhaustible. So if we are under 40 cases per 100,000 when we get 4 weeks from now, almost 4 weeks, then we don't need to do additional restrictions. If we're over that, there will be restrictions. And the point here is that we all have time to make these changes. And if we do these things, cases will go down. It's just the way it works. It's the same reason we had so many fewer cases in the summer. People couldn't congregate. If we don't do that, then we have to take these actions. And no one should be surprised. No one should feel like they've had anything sprung on them. This is up to us. The one time that we would impose those restrictions before October 31st is if that number goes over 50 cases per 100,000 for a week. That is a 40% more than a 40% increase from where we are right now. Last week we had 408 cases. We would have to be at 460 or 565 cases to be over 50 per 100,000 in a week. So it's a very significant increase. If we reach that point, from a medical perspective and a capacity perspective, we cannot wait. And so again, that's something that everybody knows. We have the ability to slow this thing down. It is my hope that we all do what we need to do and we slow this down. These are not draconian measures to slow down the spread of COVID-19. These are simple things that we can do every single day, and you'll get the results that we need. So last thing before I open up for questions was the item that came up about influenza vaccinations. We always recommend annual influenza vaccination. This year, I think it's doubly important. The influenza vaccination isn't perfect by any means, but it at least is a vaccination that will certainly reduce the number of cases as well as the severity of cases. And so the risk is that we're very concerned about is co-infection of influenza and COVID-19. They're completely separate viruses, so you could get them both at the same time. They both attack the respiratory tract, and that could be very serious to people if they get co-infected with those two. So please get your influenza vaccination. It takes 2 to 3 weeks to develop a full immune response to that influenza vaccination. So we really should be getting them now. So with that, I will stop and be happy to answer your questions.
Thank you, John, and thank you for your team. Thank you for the objectivity and the numbers and the graphs available on your website are very, very valuable. I wonder if you could comment on death rate. I don't believe that you did, nor do I remember seeing a chart in your presentation. I believe you said during your press conference that we've seen a death about every 32 hours. If our rates continue where they are, I guess I would assume that we should count on a similar death rate. If they go up, we should expect a proportional increase. If they go down, a decrease. But can you comment on rates of death?
Yep, I think that's exactly right. You know, the death rate has been fairly consistent, which means as we get more cases, we get more deaths. It was kind of an eye-opener for us here when we actually really did the math and realized that every 32 hours, someone died. All through the entire month of September, every 32 hours. You know, I've had people tell me, I just don't think this is that big a deal. And I would say to them, first of all, you should talk to the families of these people that have passed away. I think they'll tell you it's a big deal. And secondly, for those of us who have to find the words virtually every day to express the concerns and condolences we have, this is a huge loss to our community. These are people that, you know, probably would not have passed away absent COVID-19. There are those who argue that, you know, 68 people out of 160,000 is really not that big a deal. Again, death is a very personal thing, and when we start looking at deaths as numbers and not as people, then we have lost our humanity. These are real people who had real families who died. And when we try to reduce that to, well, you know, it's a pretty small number when you compare it to the whole county, that to me is just an unacceptable way of viewing human life in our community. More cases will mean more deaths. That's what it means.
Thank you very much. Questions, Councilmember Chiriki?
Mr. Mayor, Council, Mr. Felton, I would also add that the metrics that Mr. Felton is talking about, like when our system becomes overwhelmed, at that point, the death rate is going to increase significantly because more and more people will not be getting the type of care that they're getting right now. And that is why those numbers that he's talking about, we need to stay below those numbers so that we can maintain a stable, sustainable level of health care to the people who are getting sick. Thank you.
Thank you. Important point. I saw Councilmember Boyette and Councilmember Brown.
Thank you, Mayor. John, a few months ago, there was a mobile hospital set up down at the Metro. And if you just mentioned that maybe 20% of our beds are full with virus people, at what point do you say there's too many in our system, and then we need to start maybe think about that mobile hospital as they go?
Thank you. That question, we actually have a team that is focused solely on alternate care sites for our hospital patients. So you did see at the end of last week that Billings Clinic is working with St. John's to house some non-COVID patients who are less acutely ill. We are also looking at other sites, but one of the questions is what is the trigger to say we need to bring in, if we do bring in that other facility? It takes 2 to 3 weeks from the time you make that decision until it's actually up and running. And so, as I said, we do have a team that is focusing on it. They meet weekly. They look at what our numbers are. They look at what our trends are. You can sort of look down the road because patients who get hospitalized tend to get hospitalized a little later in the course of their disease. So we've got a very strong medical technical team, and then this subgroup that is looking at that. So right now we haven't made the request, but we've been in contact with Montana DES and the National Guard, so they are aware of what our situation is, and that if we do need that, we will make that request.
Thank you, Councilmember Brown.
Thank you, Mayor. John, what is the county's ability to work with other counties? I mean, 46% or so, I think you said, of people in hospital are from Yellowstone County. So that leaves, 50 some or better percent from other counties. And we can restrict, we can do all the stuff we need to do here in Yellowstone County. But if nobody else is adhering, that number is going to continue to grow and we're going to be overwhelmed anyway. So is there any kind of recourse that Yellowstone County commissioners, anyone else might have for other counties surrounding us?
Yeah, so we don't have the ability to tell them what to do from a public health perspective or a local decision. Our public health system is built on the county basis. And so my authority as the county health officer extends to the edges of Yellowstone County and not beyond. We do, though, maintain a lot of communication with other counties and other public health departments. Our 2 hospitals have developed very extensive relationships with the hospitals, the critical access hospitals in those other communities. There's a flow of patients to back and forth to sort of manage the overall population of patients. I do think that, we have spent, as a community, we've spent many, many years positioning ourselves as the regional tertiary care center for Eastern Montana, the Western Dakotas, and Northern Wyoming. And it's the position that we have taken on. We certainly communicate with them and encourage them to do what they can to manage patients in their own community and manage, the activities that lead to more cases. But I think when you look at what's out there, there's only, you can check me on this number, but I think it's there's something like 56 or 57 hospitals in Montana, and 11 of them are not critical access hospitals. About basically 4 out of every 5 hospitals in our state are critical access hospitals, which means they have limited service, they're limited size, and limited capacity. And so, by capacity, I mean clinical capacity. So the whole state is predicated on this idea of these sort of hub and spoke relationships between tertiary care hospitals in the larger communities and the critical access hospitals. So what we're experiencing is our colleagues in the larger communities around the state are experiencing the same kind of issue with serving a regional population.
Thank you, Council Members Neese and then Purrington.
Thank you, Mayor. John, when you showed us that one website, and I've been to it before, and when you narrow in on Yellowstone County, it shows that the ICU headroom is 100% capacity, meaning there's no more room left. And I talked to you this about 3 weeks ago, maybe it's been a month now. My concern on that is, we're not able to actually help some of these patients. But more importantly, is a lot of the surgeries that depend on ICU use are being postponed or canceled. Have you heard more about that? Is that happening more and more now that our ICUs are starting to fill up even more?
At this point, we're still in the position that, to the best of my knowledge, hospitals are able to continue doing surgeries. They are very cognizant of the ICU situation, which is part of the concern that led the hospitals to turn their indicators red today. So, I wouldn't want to speak to the hospital. I don't know what their surgery schedules are. I don't know, really where they are in that regard. I would encourage you to visit with the hospital leadership to find out those precise numbers. What I do know is at this point, we've not been in a situation where our hospitals have not been able to accommodate patients. But there is that movement that's going on that you're seeing now where less critical patients are being moved to other facilities. So that's really the basis of why we do need to slow this thing down.
Okay, thank you. And Mayor, may I ask another question?
Sure.
John, you mentioned you're short of staff. Would you mind indicating about approximately, how many workers are you looking for, and what kind of qualifications does someone have to come do this contract tracing for you?
So the last number I had, which was probably 10 days ago, we had 43 staff members doing case investigation and contact tracing, and it was the equivalent of 21 FTEs. So let me just put that in context for you. Pre-COVID-19, we've always done contact tracing and case investigation for certain diseases, primarily sexually transmitted infections. And we had, most of that was done by 2 staff members with everything else that they did as well. So we're at a 10-fold increase in the FTEs that are doing that work. And we still need more. And we're still hiring more. We got 5 more, I think it's 5 more coming on in the next week. We're still interviewing people. There's 2 elements of this work. One is the case investigation. The case investigation is where you contact the person. A case is a person who's positive for COVID-19. So this is the extensive interview. It's fairly structured, but you need to have the ability to take what the person says and move from there. So it does take a certain amount of interviewing skill. We prefer someone that has either a strong public health background or a clinical background, a nurse or a nurse practitioner or someone like that. Contact tracing is once the contacts are identified, and that's what happens in that case investigation. Contact tracing is basically getting a hold of those people, telling them that they've been identified as a close contact, and putting them into quarantine and providing the information about quarantine. That does not require a clinical background. That requires someone who is willing to, can make the calls, interact well with people. I will tell you, it's most people don't like to be called and told they're going into quarantine, and so it does take a certain amount of patience and sort of customer service skills, if you will. It does not require, most of those positions that do not require a clinical background. So I continue to say, if people want to be a part of the solution, they want to help with this, and they've got some time. Most of these folks obviously are not full time. We would love to get more applications for people to do case investigation and contact tracing.
Great, thank you.
Thank you. Councilor Purington.
Thank you, Mr. Mayor. Thank you, John, for all the information. I really found a lot of information in those charts that you gave. A couple of things that I wanted to ask, and with you talking about the contact tracing, which is one of my questions actually, is whenever you have to quarantine people because they have come in contact with someone, is there a follow-up with those people? I mean, how do you know that they are quarantining themselves? And then if you like, I can ask the second question because it may just go right into it.
Sure, if they're related. Go ahead.
Well, they kind of are because it's contact tracing. So are there numbers that you have been able to identify, your office has been able to identify with these businesses, the churches, the bars, casinos, the restaurants? Because those are usually the first ones that get shut down because I suppose of their proximity to each other. Even though there are a lot of restaurants, I don't know about bars and casinos because I usually don't go there. However, I do know of people that own those businesses and they have attempted to do has been directed from the county. And the churches, there are a lot of churches that have really been very strict with what those guidelines have been. So to me, that's picking the number, these certain businesses, whereas, there's other businesses that have larger numbers of people that are not, there's no way to keep them apart, if you will. I mean, you go to the large box stores. So I'm just wondering, with the contact tracing, how are you getting those numbers that it would justify to shut down businesses to 25%, where some are still struggling to make ends meet? Thank you.
You bet. So first of all, we hope that doesn't happen. And that's really up to us. With respect to how do you know if people are quarantined or not, quite frankly, you don't. People are notified that they have to be quarantined. They're given a specific date range by which they need to be quarantined. But the sheer numbers make it so that we cannot consistently follow up with and make sure folks are doing that. So in September, we had over 1,300 new cases. If each of those cases had 4 contacts, which is kind of what our average is, you have 1,300 people in isolation and 5,200 people in quarantine. I told you we have 21 FTEs, and that is 6,000 people to try and keep track of with 21 FTEs. So, what we do notify people that they're in quarantine. We ask them to comply, but honestly, nobody has the resources to follow up on all those folks. In terms of how do you pick, what areas you can try and reduce spread on? We do ask during the case investigation where people have been, and where a lot of people have been is restaurants, bars, casinos, those kinds of places. Now, it's not surprising. A lot of people go out to eat. The key difference in what happens in those types of establishments versus what happens in your example of a big box store is people don't congregate for extended periods of time when they're shopping the way they do when they're sitting and eating or sitting and drinking or standing and drinking or gambling or whatever they might be doing. Those are places where that extended interaction happens. Now, the other thing that I did ask people to do today in my press conference is to reduce the density of their non-household interactions. And I would just remind everyone, our best friend in reducing the spread of COVID-19, as well as influenza, is distance. The droplets that are spread, we use that 6-foot number for sort of general interaction and the length of time of that interaction. So what we ask people to do is to limit their non-household contacts to 6 or less people per week. So that means the extended contact. So when you go to the grocery store and you walk past someone, that's not a close contact. When you go, if you're at the mall and you walk past someone, that's not a close contact. Where people have extended contacts are in those bar, restaurant, casino types of places, as well as, we know that we have a lot of cases that are linked to family events. If we end up implementing these further restrictions, there's a limit of 25 people, regardless of whether folks can physically distance or are masked. That really gets us to a lot of those family type events that honestly nobody wants to see go away. I mean, I went to my daughter's wedding. There was 350 people at my daughter's wedding. This is 4 years ago, but I would hate to not be able to do that. But we have got to figure out what it takes for us as a community to, quite frankly, care enough about our community and the people in it to take these really simple steps. These are not draconian measures to slow down the spread of COVID-19. It's maintaining distance, limiting the density of people we interact with. It's wearing our mask when we're out and about. It's, staying home if we're sick and sanitizing our hands and surfaces. Those are not difficult things to do. What they are is they're tiresome. People are tired of it. And I can assure you, nobody's more tired of COVID-19 than the frontline folks. But we really do need to do these things. When you look at 96 patients in our hospitals and 72 hours to get case investigations done, notwithstanding the fact that we keep hiring and hiring, there's just too many cases. We have got to slow this down. And the way you slow it down is through simple measures. Nobody wants to get to, and that's why we set this up, that we've got plenty of time before October 31st to bring these numbers down. It would not have been fair to say, if this week is over 40, then we're going to close people down, because, as I said, those cases are baked in. But we have time if people will do these things before we have to do more restrictions. Trust me, as the person on the front line,
we have time for other questions. So, other council members, Councilmember Ronning.
Thank you. And thank you, John, for all the work you're doing and all of the healthcare workers. So, John, I understand what you're saying. Having just gone through a public safety mill levy where it was an enormous amount of work to get that messaging out. And, we didn't have resources to pay for a big campaign. And I understand you're wanting to get the message out of things that we need to do. Does Unified Incident Command, is that group or is there another collective group that is working to come up with a campaign, to come up with public information? I would love to be able to say that just a city council meeting or just a press release or a press conference does the trick, but we all know that that's not the case. It takes real concerted effort to get a real campaign out there. So one question is there anything like that being coordinated, or are we just doing this at a city level? Riverstone's doing it at a Riverstone level. Billings Clinic's doing it at a Billings Clinic level. And then my second question on top of that is enforcement. One of the things that we're doing at City Council is asking our legal team, what effectiveness and what power do we even have at a City Council level to enforce the directives? Is this something that we're going to have to pay taxpayer dollars to come up with a campaign? We're trying to understand what we can do at a City Council level, but how do we get that information out there? Is there a collective effort that's working on that? Thank you.
Yeah. So you've already seen probably the message that came out from the Chamber of Commerce. Big Sky Economic Development, which is sort of leading the economic response and recovery team, is meeting tomorrow, and we're going to have a significant conversation about how to message this. I think the other thing you're seeing is there will be more messaging coming from our hospitals. Today there was published a letter signed by over 230 local physicians saying exactly what I just said. These are the ways you slow this thing down, and this is why we have to. There are efforts. Fundamentally, though, this is an individual choice, right? People need to understand that they have a choice to make as to whether or not they do these things. And it is our individual actions that collectively will make a difference. So, there will be more messaging. We're going to be very upfront about what our numbers are. It's all publicly available. We'll be getting that message out regularly, but we need others to share the message. And I think you're starting to see that between Big Sky Economic Development and the Chamber of Commerce and the hospitals and the local physicians. It's becoming increasingly clear that this is a big deal.
Thank you very much. I'm sure I speak for the council in saying we want to help. Councilmember Trickey. And Councilmember Trickey, just since you had a question, I want to make sure other council members had an opportunity. We'll come back to you. Anybody else who hasn't posed a question? Councilmember Ewald.
Thank you, Mayor. The 12% of school kids, I think that was high school age kids, wasn't it? are they able to transmit that to other adults? And with your contract tracing, what age group was probably easiest to contract trace? I think it'd be really tough to do high school students. You just watch them playing soccer games and they're hugging each other. And I was a high schooler once, and I know that they don't social distance. Once they get away from buildings, that's whatever they want to do. So is that one of the big sources for the numbers going up like they did?
So as I showed you, we haven't seen a significant change in the proportion of cases that are involving people 19 and younger. It is an absolute myth that young people cannot transmit the disease. They absolutely can. They absolutely can get it. So yes, absolutely, they can get the disease. It tends to be milder, not 100%, but it tends to be milder, which is why we have really worked with the schools to reinforce a very low threshold for testing school-aged people who become even a little bit symptomatic. That's the way you slow down. No doubt, it is difficult to get students of that age to physically distance. We have engaged the schools as our partners in identifying close contacts when we have cases involving schools. So they've been working really well with us to help us more quickly identify those students or staff members and get them into quarantine. In terms of I don't think I can give you an absolute answer as to who is the easiest. I will tell you that one of the real challenges is when people either don't answer their telephone when we call, or don't return messages, or have full mailboxes so we can't leave messages. So then we end up mailing them information about what it means to be in isolation and how to identify close contacts. But when you look at our numbers, about a quarter of people we are not able to make contact with. They won't return our calls.
Follow up, Mayor, please.
Go ahead.
Okay, John, if a nurse at a school determines somebody's got COVID, can they send them home, or does the county health person have to take care of that 2 days later?
So for schools, we have deputized school employees as public health officials, which means that they can put people into quarantine. So they can do that directly. The reason we do that is we don't have access to the information like seating charts and who sits with whom at lunch and that sort of thing that people in school do. So yes, the school officials who are properly trained in contact tracing and contact identification, and that we have agreements with, they can put those students into quarantine.
Thank you very much. Councilmember Tricky, just a reminder, we are now close to 6:30. We'll need to wrap up so we can move on the rest of our meeting, but I don't want to cut others off. Councilmember Tricky?
Mr. Felton, would it help, or do you think it would be a good idea if the city were to hire a PR firm to coordinate and create a campaign to slow down the spread of COVID, especially understanding the fact that this is something that would be reimbursed by the CARES Act?
Yeah, I think any effort that is a concerted effort to get the word out to people would be appreciated. I don't know what that means from your perspective as how you do that, but I think it's not only the messaging, it's making sure that when we as public leaders are out in public, that we are maintaining our distance, we're wearing our masks. It's really important. All of you and I are pretty recognizable. A couple of weeks ago, I was participating in our organization's 5K walk, and a complete stranger stopped me in the middle of that. It's a virtual walk, and started asking me questions. So we are recognizable. When we're out in those public establishments, we need to follow the rules. That's really important. But any effort you can to expand the communication, we would be certainly in favor of.
Thank you very much. Councilor Brown?
Thank you, Mayor. John, I just want to clarify that if the county were to go back to the 25, add more restrictions, that's solely based on Yellowstone County, not the beds that are full in the hospitals due to COVID, right?
It's solely based on the cases of Yellowstone County residents who become diagnosed with COVID-19. If we get 1,000 people who come from another county or another state and get tested here, those people don't count in that number. These are Yellowstone County residents only.
Okay, thank you for that clarification, John.
Thank you. Let's wrap up here. Back to Councilman Trickey.
I know that there's a lot of talk about the economic impact of doing these types of things. Have you guys been spitballing, modeling, or thinking about what the economic impact would be if the pandemic shut down the economy?
We don't really have at Riverstone Health that type of modeling capability, but what is very clear is that as we see more and more cases and you start multiplying by 4, or really 5, so you get the case plus their 4 contacts, I just mentioned that, that's 6,000 people who were not in school or not in the workforce in September. That becomes a significant portion of our community when you start adding all those pieces together. We have had anecdotally businesses that have had to close for periods of time because too large a proportion of their staff were in isolation or quarantine. So it does add up. And people could be put in quarantine multiple times if they're not careful. If they get exposed, they come out of quarantine, they get exposed again, they go back in quarantine.
Thank you, sir.
Thank you.
Can I make just one last comment really quickly?
Well, John, let's give you the last word.
Okay, thank you. Appreciate your time, and this is obviously a big topic for our community. I did want to mention that we are moving our testing site. Riverstone Health has been testing at the Shrine Auditorium parking lot. The weather is getting cooler, and soon it's going to be problematic to have people standing outside doing testing. So we are moving to on Overland Avenue. I think it's 2173. It's the United Way building. Has 3 garage bays. We are renting those garage bays from that organization, and we'll move our testing inside. So we'll be testing through Thursday of this week. We won't be testing on Friday, and we'll open up on Monday, 8:30 to 12:30. So a little expansion of hours at that indoor site.
Thank you. And John, just to clarify, to be tested there, one has to be either symptomatic or have been told that they are a close contact of somebody who has tested positive. Is that correct? You can't just show up.
Yep, correct.
Okay. Okay. Councilmember Running, a quick final.
Can you clarify, are these tests that are done through Riverstone Health, are those free to the people that are being tested, or does it have anything to do with insurance, or is it free to the public and those people that qualify for testing?
There's no charge for anyone who comes through our site to be tested.
Great. Thank you for clarifying that. John, again, our appreciation to you and your overstretched team. We wish you the best in finding some help, and whatever we can do to help, please let us know.
All right. Thank you very much.
Thank you. Thank you, everybody. I don't want to say I apologize. That was a lengthy conversation, but it's hard to imagine anything more important right now than knowing what's going on with the coronavirus. With that, then we'll move on to public comment. This is an opportunity for the public to call in. Please do so right now. If you'd like to be heard, the phone number is 237-6196. That's also on our agenda. That phone number, 237-6196. Again, call in right now. We'll ask you to keep your comments to less than 3 minutes and to identify yourself with your name and address at the beginning. While we wait for those numbers to come in, we'll look to those phone calls. If there are any, we'll look to our city administrator, Chris Kukulski.
Thank you, Mayor. I just wanted to let the council know. So for the past 6 months, we've had 23 positive tests of our city employees. So recognize we've got a little over 920 full-time employees. So 23 positive tests over that 6-month period. And we've had about 132 individuals who've been quarantined because they were in close contact with someone who had a positive test. So just a couple little data points for you guys to be aware of for the city as an employer. So I know it sounded like we got a call coming in. I thought that'd be a good plug to give you that information. Thank you.
Perfect. Thank you very much. Denise, do we have callers?
Yes, we do. We have a caller on the line right now. One moment, please. Hello, and thank you for calling. This is the City Council public comment line. You will have 3 minutes to give us your comment. May I have your name and address, please?
My name is Barbara Pruitt. My address is 310 South Billings Boulevard.
Okay, go ahead.
Okay. I'm against the Jackson Street development. I feel that the increased traffic on Jackson Street will be dangerous for our children walking to and from Orchard School. Also, when they walk to the Boys and Girls Club on Orchard, or when they're just on Hollowell in general. The schools are at their capacity now. The infrastructure isn't, there is none. So that's bad. The crime rate is also high in this area. Adding a 38 additional rental units will not only add to the population in the area, it will add to the crime rate, litter, and traffic. I understand that some of these units will be for elderly or special needs individuals. I feel that they will be at risk in living there just because they have to depend on someone else to help them. This is not a place where I would want an elderly person or a special needs person to live by themselves. It's not safe. And I also heard today that they want to add a Rimrock rehab, which is 124 units to that same area. And there's just the infrastructure is not there. And somebody had something about, are you guys trying to redline the south side, redlining?
Mrs. Pruitt, I think we're going to cut you off. I think you've got about 3 minutes. I apologize. I probably didn't make that as clear as we should have. This was the time for public comment just on that first item, but I didn't want to stop you. We got your message of opposition to the Jackson Creek project, but we do need to confine comments at this point to just this, the first item, which was our COVID-19 update. Anybody who else would like to comment on the Jackson Street project or anything else that's not on our agenda tonight can do so, but they'll have to wait till the very end of the meeting as a courtesy, so we don't have to make you wait when I let you go ahead there. But this is just the time for the COVID-19 topic.
Oh, I thought this was open comments.
Yeah, no, I understand, and I did not make that clear enough for you. So my apologies, my fault, not yours. But we did get your comments, and we'll take that into consideration at the end of the meeting if there are others who also want to call in at that time.
Okay, so do you want me to call back then?
I don't think it's necessary. I think we got it. Feel free also to send us a letter or email if you want to expand on anything further, though.
Okay, I'll do that.
Thank you very much. Denise, do we have anybody else who has called 237-6196 to comment on the first item, the COVID-19 update?
Yes, Mayor. One moment, please. Hello, and thank you for your call. You've reached the public comment period for tonight's City Council meeting. You'll have 3 minutes in which to give us your comment. May I have your name and address, please?
My name is Steve Pascal, 310 Rhubarb Lane.
Okay, go ahead.
I guess this question would be more related to ask John, but my question is, when they do the testing, does anybody ask if they never wear a mask or usually wear a mask or always wear a mask? I mean, we're getting these numbers, but we don't really know from what group of people are, becoming positive with this stuff.
Okay.
Thank you very much. Mr. Askell, we generally don't use this as a dialogue time back and forth, but I don't know if John Felton is still on the, I don't see that he is. So I would suggest that you call Riverstone Health and put that question to them. I don't know the answer. I suspect they do not. I've never heard of that data being tracked. It would be interesting, but I have not ever heard of that. So.
No, and that's what, everybody says that, one of the ways is to reduce this is to, everybody walking around wearing a mask, but nobody has any numbers on that.
Okay. Thank you for the call. Go ahead and email or call Mr. Felton.
Okay, thank you.
Thank you. Okay, Mayor, I believe that is all of our callers this evening.
Okay, thank you very much. We'll close the public comment period then on item number 1 and move ahead to item number 2. This will be our complete streets progress report. I believe Elsie Monat from our public or from planning is with us. Chris Kukulski, anything before we just hand it over to Elsie?
No, we can turn it over to Elsie. I know she's ready to go.
And I know Jed from Lyft is also with us, but I'll let Elsie do those introductions. So Elsie, all yours.
Okay, hi everybody. I'm going to share my screen with the presentation. You can all hear me okay?
Yeah, a little louder.
Okay. Can you hear me now?
Yes, great.
Okay, great. And you're seeing my presentation full screen?
Yes.
Okay, great. So hi everybody, my name is Elise Monat. I am the Active Transportation Planner with City County Planning, and I'm here today to share with you the Complete Streets Progress Report from 2020. And with me are Melissa Henderson from Healthy by Design, as well as Jed Barton from Lyft, which is Living Independently for Today and Tomorrow. I believe Debbie Melling is also on the line in case you all have any questions at the end about specific projects that Public Works is doing. And I know Wise Friday from our department is also on. So this report was really a very collaborative effort. We worked together with Healthy by Design, Riverstone Health, Met Transit, Lyft, which as I mentioned is Living Independently for Today and Tomorrow, Billings Public Works, Billings Planning and Community Services, and then also we have a wonderful advocate, Kathy Aragon, who just kind of represents herself. So I'm going to turn it over to Jed Barton to talk about what Complete Streets are. He's the Outreach and Government Affairs Coordinator at Lyft. So I'm going to hand it over to Jed. Okay. Jed? Jed, are you on? Oh, Jed?
Hello.
There.
All right. Thank you, Elise. Again, as she said, my name is Jed Barton, and I am the Outreach and Government Affairs Coordinator at Living Independently for Today and Tomorrow. And again, what are Complete Streets? Complete Streets are not a one-size-fits-all, excuse me. Complete Streets does not prescribe a one-size-fits-all design template for every street. Instead, what it does is that, as you can see on the slide here, there are a variety of elements that can be incorporated into a street in order to make it more complete. What does it mean to be complete? At its core, I would say that Complete Streets is about a commitment to designing and creating a transportation network where, in so much as possible, when you consider things such as geography and the needs of the community and the desire of the community and the type of place you are in the community, be it residential, commercial, or industrial, that everyone has a safe and direct way to get where they are going, regardless of the mode of transportation they use. If we could get the next slide there, Elise. As you can see, that Streets for All would be another way to put Complete Streets. And these are all of the different ways folks access our streets and our sidewalks. You've got transit, you've got people who utilize wheelchairs and bicycles and walking, and of course, driving. And what Complete Streets does is it is it commits those who sit down to design our streets and our transportation network to think about each and every one of those modes, not necessarily favoring one or the other, but making sure that everybody has at least some of what they need in order to have safe access to where they need to go.
Hi, everyone. I'm Melissa Henderson with Healthy by Design, and Elise asked me to share just a little bit of history on Complete Streets. So Healthy by Design actually initiated the Complete Streets effort back in 2010 in response to a needs assessment. So as you all know, every 3 years, we work with the hospitals, the health department, and many organizational leaders across the county to conduct a needs assessment. And in the 2010 assessment, we saw that we were lagging behind other Montana communities in terms of healthy weight, physical activity, and we're also starting to see some of our children slide less and less into activity and doing more screen time. One of the questions we asked our survey respondents was, what would help you become more active? And what we heard was convenient access to trails and bike lanes. So we as a coalition worked with Darlene at the time with the planning department to hold a Trailhead to Health Summit, where we brought together community leaders and residents to ask what we should do about it. And the result of that summit was that a Complete Streets policy would be beneficial for the community. And so in 2011, we worked with different leaders and organizations to work with you guys, the City Council, to adopt that policy. It was unanimously adopted in 2011. Following that, we worked with the city and then contracted with Alta Planning and Design to create a benchmark report in 2013. That was early enough that the policy hadn't completely gone into effect, but we understood, okay, this is how it could be implemented. So the benchmark report really served as a baseline. And that's not to imply that Billings wasn't doing things around bike lanes and all users before this. This just really helped elevate that as a priority for planning and public works. Following that first report in 2013, the newly elected City Council in 2016 asked to revisit the policy. And this was a result of just starting to see more sharrows, more signage going up, really wanting to reflect on, is this the right policy for our community? And if so, do we want to make any updates or tweaks? And so in 2016, the dialogue really focused less on improving physical activity and more about really what Jed is talking about, access to daily needs, making it so that any resident, no matter how old, how young, regardless of ability, could be an active member of our community. So in 2016, City Council adopted an updated policy to include not only a checklist for projects to better understand why do some streets get this treatment while others don't. In many cases, it's because the street just a block away was considered complete, and so let's funnel people there. But in addition to that, that's where we introduced the concept of when arterial and collector projects come to design, at that 30% review stage, they can have public comment at a City Council meeting. And again, the point of the Complete Streets policy is to really focus on healthy and active living, but also think about the quality of life in Billings, making sure that as we have diverse users on our roadways, that there's predictability, there's safety, that everyone has a place where they can get to their daily needs without kind of conflicting with the others. And some of the data Elise is going to show will show how that's improved. As you know, we're here today to talk about our progress report. We do a published progress report typically every 3 years. Sometimes it's been delayed based on needs assessment data, but we're really excited to show you the data from our most recent report.
Thank you, Melissa and Jed, for sharing those comments. Trying to advance my screen here. Okay, so in order to evaluate our Complete Streets policy, what we do is look at different performance measures across different modes and different subjects like connectivity, community health, and things like that. So first we'll take a look at walking and rolling. So how we started out assessing how we're doing with walking and rolling is we measured at 5 different locations across the city the average pedestrian count per hour at these intersections. So we started measuring in 2013, and so we've taken them 4 years since those counts. There are a few gaps there. Those were due to construction or other reasons where we couldn't get our counting equipment in there, or maybe people weren't able to walk in that location during that summer. As you can see, some of these counts have gone down in 2019. That could be due to a lot of things. We only take them on one weekday and one weekend, so it could really be very weather dependent, really smoke dependent, if there was construction or something else like that around. And so one thing we're going to do going forward is look to see if maybe we need to assess a few more intersections for this report in order to get a really good picture of what's happening in Billings. Maybe 5 locations isn't enough. So it's just kind of something we're keeping in mind there. Next, we looked at the sidewalk inventory. Hopefully you can see this well enough, but the dark green sections are places where we have sidewalks in Billings. And I want to say a big thank you to our GIS division, who spent a lot of time and effort translating the new aerial photographs into GIS data there. So what we found out is that 71% of streets in Billings have sidewalks on at least one side of the street, 29% do not. And that 71% is a 4% increase from our last progress report. In terms of crashes involving pedestrians, they've held pretty steady. There have been some ups and downs since 2009, but in 2018, it was pretty much equivalent to 2009. Unfortunately, across the country, 2018 was a very deadly year for pedestrians. They saw more people die in crashes while they were walking than pretty much any other time that they've been recording that. And Billings was no different. We had 5 people die in Billings in 2009 while walking, and that's a lot more than we've had in recent history. Next, we looked at bicycling. So we did the same thing. We take counts at several locations across the city. These counts have held fairly steady in 2019, which is obviously the most recent year we have data for. And I want to mention again that those gaps are due to construction and other reasons we couldn't get in there. One other interesting thing to mention is that, as we add more bicycling facilities to our system, you might see less people using these exact facilities and more using a different one. So for instance, with the Minnesota Avenue and South 27th Street location, that's probably not where I would bike. If I were biking onto the south side, I would probably go on Minnesota and 28th or 29th, because obviously 27th is just so busy. So many cars going quickly. So I would probably choose another location. So that's probably something else we're going to look to in the future is, do we need to select more locations? And also, do we maybe need to adjust these locations that we're looking at? In terms of crashes involving people biking, in 2018, they were actually the lowest since 2009, which is really great. I think a lot of times people are concerned if there are more people out there biking, that means we're going to have more crashes involving people biking, and the data shows that that's not true. This is a graph of our shared use paths added. So as you can see, the darker green bar graph is the miles that we've added per year, and the lighter green is the cumulative number of miles we have. We have about 48 miles of shared use paths in Billings, not including the smaller neighborhood connectors. And as you can see, between 2002 and 2012, we were able to add quite a few miles of those paths. And that was due a lot in part to the Community Transportation Enhancement Program, where we got money from the federal government every year that we could count on and use to plan out different trail projects. And so since about 2014 to 2020, our Public Works Department has been doing a really great job of adding trails anytime they construct or reconstruct arterial streets. But there's just not as much funding available as there used to be. This is a similar graph. This time the subject is bike lane. So the darker blue you have miles added per year of bike lanes, and then the lighter blue is cumulative miles added. So we have about 27 miles of bike lanes. Once again, we were able to add a pretty good number between 2010 and 2015. That's not necessarily due to anything in particular like that federal funding. It's just kind of how it shook out. And once again, I would say that our Public Works Department does a great job of adding those whenever they do repaving projects on roads. So next, we looked at transit. The transit data shows that it's trending downward slightly in terms of the number of riders per year, but staying fairly steady. And one important thing I want to point out on this graph is that there are a number of people like students, people with disabilities, and seniors who might not be able to get around independently without Met Transit. So this is a really important service for people in our community who may not be able to drive, whether that's because they're too young, maybe they're not able to drive anymore, maybe they have a disability that prevents them from driving, or maybe they just can't afford a car. So Met also tracks their bike rack and lift uses. And what we see is that the lift use, so that's the device that helps people using wheelchairs or their mobility devices get onto the bus, there's an increase in use in that lift. And so that reinforces that the lift is really important and that Met Transit is really important for people with disabilities. So we also looked at automobiles because no matter if you're walking, biking, taking transit, generally you're going to interact with a car somewhere. So in this section, we looked at the crash data for Billings from 2009 to 2018. And as you can see, it's trending downward. So that also reinforces the idea that even though we've got more people out there biking and walking, they're doing it safely. And generally people say that if you have more people out there biking and walking, then the community is more aware. And so that does make it safer for people out there. This is a graph of our mode share. As you can see, we have 83% of people drive alone. And I do want to mention that this is just commutes to work. That's what the American Community Survey tracks. That's from the Census Bureau. So that's what we're able to track. Then we've got 3% of people who walk, 1% of people who bike, 1% of people who take transit, 8% of people who carpool, and 4% of people who use another mode. So those may seem low, but I do want to mention that that's really on par with the rest of the nation. So we are pretty much in line with other communities there. Next, we looked at connectivity. So the U.S. Department of Transportation says that well-connected multimodal networks are characterized by seamless bicycle and pedestrian infrastructure, direct routing, accessibility, few dead ends, and few physical barriers. So if you look on the left, you can see in that community, there are a bunch of dead ends and cul-de-sacs. So if you imagine a kiddo in that purple house right there trying to get to school, they're probably going to have to walk a long way around in order to get to the school, unless they end up cutting through their neighbor's property, which we would not encourage them to do. And then also to point out, when they're walking to school, they're probably going to be on these more main collector and arterial streets with higher traffic volumes and higher speeds. So their parents might be less likely to encourage them to walk to school. Whereas if you look at the image on the right with the connected street grid, you can see it's a lot quicker for them to get to school, and they're probably also going on local streets where it's a lot safer for them to walk. So in terms of connectivity, we also looked at, are our bikeways connected? And as I mentioned, our Public Works Department does a great job of adding bikeways when they can. But unfortunately, our bikeway network isn't necessarily all the way connected already. It's a little bit hard to see, but if you look at those slashed lines, that's where bikeways are. So I don't know if you can see my mouse, but this is the bike lane on Rimrock, then you've got the one on Poly, you've got a couple here in the Heights. a couple on the west end. So if you think about, the same thing about sending a kiddo out to school, a parent might be more cautious to send, maybe an older elementary school student out to school if there's not a connected way to get there via bikeways. One other thing we're also very excited about is the bicycle boulevard that is coming up and is in our capital improvement program. So that's going to run from the North Park area up to Rimrock Road. I'm going to turn it back over to Melissa to talk about community health data.
Thanks, Elise. So as I mentioned earlier, the Complete Streets policy really came out of the need from the health community to want to respond to the community health needs assessment. But we also hear from our hospitals, who are two of our largest employers as a community, that people are looking for walkability and bikeability and neighborhood schools where their kids can walk to school. And so that's important to consider as well. So I'm just going to go over a couple really simple health data points to show where the policy is impacting. And so in terms of weight status, so at the outset of the policy, we said we want to track if this has an impact on overweight within our community. That is, the big draw, the big focus of this past 10 years within a lot of community health initiatives, and was certainly something that we wanted to respond to. And what we see overall is we're still struggling a little bit as a community when it comes to being compared to the state or to the United States, but we are seeing some improvements. The most recent needs assessment showed a little bit of an uptick, but overall, we're trying to level the playing field here. When it comes to overweight status as well, the rate among children is pretty similar to adults. In regard to physical activity, these are a bit tiny. The graph on the left shows adults in Yellowstone County that are meeting physical activity recommendations. And what you can see there is we're pretty much on par with the state and the United States, but there's definitely a leveling off here. A graph that we don't have shown here is, while the number meeting the actual recommendations of 150 minutes of moderate activity a week isn't changing, we are seeing increases in the amount of residents that are saying, I am increasing my day-to-day physical activity. It might just not add up to that 150 minutes. So people are going on walks on their lunch break, things like that. In addition, when we look to youth, we are seeing improvements in youth overall, a little bit of a dip since last time, but still substantially higher from when we first started measuring this. And what I'm really excited about is when you look at this data, girls are catching up to boys. So it used to be that boys were sort of an outlier and dragging this data up, but we're seeing more and more girls be active within our community, which is awesome news.
Okay, so then we also looked at economics and how Complete Streets affects our community economically. And what we know is that Complete Streets are really great investments for our community. Big Sky Economic Development says that Billings has an aging workforce with over 40% of the workforce in the 55 plus category. And so what that means is that we're going to need to find people to come live in Billings and contribute to our economy and our workforce. So Lincoln, Nebraska actually highlighted their trails to address a worker shortage and spur economic development, and that worked fairly well for them. A couple of other interesting statistics. Fort Worth, Texas added bike lanes and bike parking, and that added up to a 100% increase in retail sales in that area. And I think even more amazing is in Lancaster, California. They spent $10.6 million to implement their Complete Streets policy, but they ended up getting $125 million in private investment, 26% increase in sales tax revenue, and 800 new jobs. So I think if you look at that, that's 10 times what they put in there just in terms of the private investment that they got. So I think that's pretty incredible. Looking towards the future of Complete Streets, there are several projects within the capital improvement program that have Complete Streets elements. I'm not going to list them all here, but obviously I mentioned the Bicycle Boulevard before, which is coming. And there are other great projects that include pedestrian or bicycle infrastructure, such as the project on 32nd Street West between King and Gable. and that's going to have a trail along the side. And I'm sure Debbie can speak more to that if you have questions about that. And then just other things like our Public Works Department is replacing the detection infrastructure on our intersections. So now when people biking come up to the intersection, there's going to be a new camera there that will be able to detect the person biking. Whereas before there were induction loops that only detected cars. So if you got to an intersection like the one at 3rd and Grand, I always get to on my bike and it doesn't see me there. So that will be changing soon as we implement new detection systems for intersections. And then that's all we have to share with you guys today. Do you have any questions that we can answer? I'm available, as is Jed, Melissa, and Debbie.
Thank you very much, Elise. I apologize for mispronouncing your name, as I often do at the beginning. Melissa, Jed, thank you very much for your comprehensive, and the written report is available for members of the public. It's very detailed, very well done. And it's available as part of our agenda packet. So I encourage anybody from the public who's interested in seeing a lot more detail to check out the full report that's available again at the City Council's or the City website. With that, questions for any of our presenters or staff? Again, Debbie Melling and other staff are available. Elise, I'm going to ask you to close off your screen if you can, and that way I can see all the council members and their hands as they go up. I see hands from Councilmember Ewald. Councilmember Ewald and Councilmember Shaw.
Thank you, Mayor. I'm just going to start out with a real easy question. Fort Worth, Texas was brought up that they put new trails in and parking space and 100% retail sales increase. Is that the only thing that caused the retail sales to increase, or is there other factors that also went along with it? I can't possibly believe this bike trails increased at 100%.
Thank you, Council Member, for your question. Of course, it's hard to isolate things exactly, but if you would like, I'd be happy to send you the report that gives more information about how they determined that. I can send that as a follow-up email.
Okay. Okay, thank you. Councilmember Shaw.
Thank you. Elise, I think this is for you, maybe Debbie. Would you talk a little bit about enhanced crosswalks and that is that part of the Complete Streets program? Because I feel like it's such a critical piece of safe routes to school. And I'm sure other council members get calls on this all the time where people saying, why isn't there a crosswalk here? Or why isn't there a crosswalk there? Or this intersection is unsafe. Would you talk a little bit about that kind of from the policy perspective of how is that determined by you guys? Does that make sense?
I think, Councilor Shaw, that was for our city engineer, Debbie Melling, is that right?
Or Elise, I don't know, whichever one of them feels more equipped to answer. Okay, thank you.
Thank you, Councilmember, for your question. I'm just going to jump in and probably turn it over to Debbie, but those are absolutely part of the policy. We had that slide at the beginning that shows complete streets are a lot of different things, whether it's sidewalks, trails, bikeways, safe crossings, roundabouts that make it safer to cross. So yes, those are absolutely part. I'm going to turn it over to Debbie maybe to explain a little bit more about how they decide where there should go.
Thank you. So most of the crossings we have, as you know, are at schools or really high pedestrian areas, and our enhanced crossings are typically where we have trail crossings, again, with high use. We just have started the program last year to try to put more of those enhanced crosswalks in. I am sending you all an email tomorrow because we just got the one on the Kiwanis Trail put in and some pictures back today. So that is in and functional today. So I think with the new line item that we have in the CIP, we can do several every year, and they'll mostly be, again, on those school crossings of arterials and collectors is where we'll start.
Thank you very much. Can you just remind us what some of the laws are on bicycle use on sidewalks in our city? I think it's an important point for all of us to remember. I think they're perfectly allowed on every sidewalk with the exception of the central business district. Is that correct? I don't know who can comment on that, but Councilmember Ewald's nodding his head. So is that, and Elise, that's your thumbs up?
No, I was saying I can answer that. Yeah, thank you, Mayor. No, so you're allowed to bicycle on the sidewalk in residential districts. So if it's a commercial zone, then you're not supposed to. Now, obviously, we know sometimes, it gets a bit dicey if people are out on King Avenue West or something like that. You might see them biking there, but it is especially important, I would say, in the central business district because you've got so many doors opening, such high pedestrian traffic that obviously, you don't want to open a door into somebody bicycling, nor do you want somebody bicycling to, run into somebody walking as they get to an intersection or something like that. So,
thank you for that clarification. Other council members, Councilmember Purington?
Thank you, Mr. Mayor. I'm not sure if this is for Elise or Debbie. Having become a designated complete street or having that policy as a complete street, does that mean that Billings gets additional federal funding for that designation? I think the last report that I saw, there's a little over 600 cities throughout the United States that has a complete street policy. So can you tell me if there is extra funding and to what degree and what we hope to gain with that extra funding?
Yes, thank you, Councilmember Purington. Unfortunately, there is not additional funding, and there's actually over, I think it's 1,500 localities across the country that have complete streets policies. As I said, unfortunately, there's not federal funding right now for it. I know that they've been trying to get extra funding for complete streets in Congress with the next transportation bill. So we'll see where that heads, but I don't have any information right now on that. And if Debbie wants to jump in with anything, please do.
Thank you, Councilmember Joy.
Thank you, Mayor and Council. I was just wondering how the lift, you did an assessment and an evaluation of accessibility around Rose Park School, Elementary School. And I was just wondering, what were some of your findings in that audit? Thank you.
Thank you, Councilmember Joy. I'm going to turn that over to Jed if he is still on the line.
Yeah, I'm here. Can you hear me?
Yes. Great. Go ahead.
Mayor, Council Member Joy, members of the council. We turned that data that we collected over to the Rural Institute on Disability and Health, or on the Montana Disability and Health Program, and I have not gotten the final report back yet. And I will definitely provide that to Councilmember Joy and anyone else who wants to see that when they do see it. One of the things I can remember from being out there, again, I was one of the people who conducted the actual survey, is that there are areas right near Rose Park School where sidewalks are in somewhat disrepair. And there were some concerns about the slope coming off of the driveways of some of those houses. Again, that's an older part of our community. We're talking immediate post-war era there. So folks building didn't have the same regulations or concerns, but I will definitely get back to Councilmember Joy and anyone else who's interested with the more detailed information.
Thank you very much. Councilmember Neese and then Councilmember Trickey.
Thank you, Mayor. I have a couple of points. I'll ask one first. This is to Elsie regarding the data you mentioned. I think Frank also asked about whether or not the data points to the facts of the data doesn't really point to what there is, really what is the cause of the data being switched. And I didn't read this in your report when I first read through it, that those points that you measured for were only 1 day. I'm glad you brought that up. But it does make me want to question the rest of the data within the report, because 1 day measurement is really not valid. And so I'm concerned that we would have that data in there. I think if you're going to do some measurements, you want to measure those a longer period of time. It gives you a little bit more validity to the data of measuring. So I am concerned about having that 1 day data in there. I don't know if that means some of the other data is not really relevant. So I would hope that report get corrected, or maybe remove some of that data that's just not really valid. So anyways, I read through it. I was a little concerned about that. And Mayor, if you don't mind, I do have another question. Is that okay? Or you want me to? Okay. Regarding the connectivity, there's a slide that you showed. I don't know if you can see it. It's that slide. My background is blocking out. It had the cul-de-sacs type of a neighborhood, and then they had the streets with the connectivity through that. In my understanding is a lot of people like that cul-de-sac, living on a cul-de-sac, not a lot of traffic going through that. And so that's usually a higher value of property, and the people desire that. Maybe a little less crime because you don't have all that. So when you look at this complete street connectivity like this, do you take into consideration what the development and design is doing for as far as being complete streets, and then also how it can or cannot reduce crime? Is that something that's in? I didn't see that really any kind of crime data in the report, because that's part of the safety. And so by not having a complete street, having a cul-de-sac, you probably can reduce crime. By having a complete street where you can get, the crime can go through, people can escape from their criminal activity, then it would not be a safer neighborhood. So do you take into consideration, at least I didn't see it in that, or would you can take in consideration any kind of crime data as far as what you do when you do have these complete streets like this?
Thank you, Councilmember Neese. I want to point out that the Complete Streets policy, as we have written, just applies to arterial and collector streets. So when we talk about what's being brought to council, we're just bringing those streets rather than local streets. But I do want to say that generally when you have more people out walking, biking, having more of a community feel to their neighborhood, they generally consider that to be eyes on the street, where you have more of a community feel. The community is looking out for each other more, and they're going to, try to create a safer community together. So I would point that out as a benefit to complete streets in terms of reducing crime.
Yeah, okay, thank you.
Okay, thank you. Councilmember Brown?
I don't think I have a question as much as a comment. I really appreciate your guys' group and the Complete Streets for the changes that we have made. Over the past several years, it seems like we have more of a plan to move people on bikes and things like that, in an orderly fashion, using less busy streets and doing some of those kinds of things. It used to just drive me nuts. It just seemed like it was put a bike trail on every single street and see what happens. And it just feels a lot better. And part of what Councilman Neese was saying, I think that's part of why they're doing so many trails in neighborhoods now, is so that they can still have those cul-de-sacs, still have all of that, but they're still walkable. The one over here off 32nd, just off at Keene there, that subdivision there, they did that. They've got those trails, and then they go to a crosswalk, and they're really, really nice. They keep the kids completely off the streets for the most part. So I just wanted to voice my appreciation for the changes that you guys have made and going in that new direction. So appreciate it a lot.
Great, thank you very much. Other questions for any of our presenters or other staff? Sounds like we'll recognize Councilmember Purington, but sounds like we're probably getting close for public comment. Just a warning to any members of the public that if you'd like to comment on this item, the phone number will be 237-6196. We'll open it up for public comment probably in just a few minutes. So stay tuned and be prepared to call that number, 237-6196. Councilmember Purington?
Thank you, Mr. Mayor. This may be for Debbie, but Elise, she might be able to respond as well. So we have two policies. It sounds like we have a complete street policy versus we have safe routes to school. Do those not converge at some point? Or are they completely differently funded, or what is the difference in that?
Yes, thank you, Councilmember Purington. So we have one policy for complete streets. The Safe Routes to School, it's more of, we have a report where we studied what are some things we need to do to have safe routes to school, as well as Public Works looks at different locations where they can implement those different recommendations. We also have Healthy by Design and Riverstone Health have done a lot of safe routes to school, different elements, including walking school buses where trusted adults walk students to school so that parents are more confident that their kids are getting there safely. So I would say that's the difference. And Debbie, please jump in if you have anything else to add.
Thank you.
I'm not seeing Debbie Melling jump on, but if she does change her mind, we'll give her that opportunity. Councilmember Ewald?
Thank you, Mayor. I've got a couple questions. First one is, the one slide you showed, there's 1% of the traffic is bikers, and I think it was 3% people that walk and 83% in automobiles. So how can you justify shutting down streets at intersections for automobiles when the big disparity in percentage of traffic? You got 83% automobiles and 4% walkers and bikers.
And yeah, Councilmember Ewald, can you just clarify what you mean by shutting down streets?
Bike boulevards they're planning in the CIP, they're going to shut down the intersection, so cars got to drive 6 blocks to get to the house across the intersection that they were planning on going to.
Okay, bike boulevards.
Mr. Mayor, this strikes me more as a policy question than an actual implication of this report, and I kind of think it's out of order.
It was in the report, Mayor.
Yeah, I'm going to overrule that. I mean, this is what we're talking about, so this is a great opportunity. Elise, can you comment on the utility of bike boulevards, given that it does impact the flow of automobiles? And yes. Debbie Melling, if she's with us.
Yeah, I was going to mainly turn this question over to Debbie. As far as I know, they have not started to design the bicycle boulevard yet, so we don't know what it's going to look like. Public Works is going to design something that works well for our community. And generally, if there were any diversions, it would only be for one block. So there would just be one block that somebody would have to go around. And I just also want to comment, we had comments, the public actually reached out to us wanting this bicycle boulevard. There were some parents who live on Woody Drive, and they don't necessarily bike or wouldn't necessarily use this bicycle boulevard, but what they said is they have a lot of cut-through traffic happening in their neighborhood, and this bicycle boulevard is going to help reduce that cut-through traffic and really return these local residential streets to their true purpose, which is to serve, the residents that live around there. So even though that group of residents isn't, necessarily going to go out and be using this bicycle boulevard, they reached out to us and said this was something they really wanted. So I'm going to turn it over to Debbie, and she can maybe comment more on the design part of it.
Debbie?
Thank you. We have just started into the design of it, and Elise is right. We don't have it laid out completely yet, but we're talking about one diversion every 8 to 10 blocks probably. And the whole goal behind those diversions is to keep streets local. We have the same problem when we put stop signs up. There's a lot of streets that have kind of defaulted to collectors and arterials almost because we put stop signs up and made them through streets. and it really impacts the neighborhood. So by doing the diverters, we're keeping the local street as local streets and still enabling those through movements for the bikes. So if we just put the stop signs in and made them bike boulevards without the diverters, the cut through traffic would be horrible for the neighborhoods. And we really wanted to avoid that. So that's the whole goal behind it.
Okay, thank you very much. Other questions from staff? Councilmember Bernice, will come back to you. And is there anybody who had a question?
I had one more question.
Okay, Councilmember Ewald.
Okay. These trails we're putting in all over. I do a lot of work on the west end, and I see that trail on the side of the big drain ditch that runs along Shiloh. And when bikers get on them, they come flying down there and they don't even slow down when they come to the road intersections or street intersections. And as the trail becomes older, vegetation starts growing up. And I don't know how these cars are supposed to be able to see these bikers or runners or whatever coming there. A bike traveling 20 miles an hour goes a lot of feet in a short distance. So I was up at Big Sky driving around the other day, and they got signs up there on the bike trails that says yield to automobiles in the intersection. Now, what would be wrong with doing that here? They don't just have the right of way just because they're on a bike. There's 1%, 83% automobiles. And it would probably be safer for the bikers too, at least for them to slow down and look, because as the vegetation goes up, it's just going to keep getting worse.
Okay, thank you. That sounds like a question for our city engineer.
So I'll try to answer what I think the question was. Yeah, I think anytime someone's on a bike, they need to be aware of the fact that a bike is smaller than a car. I mean, that is just the fact. However, people in cars need to be aware of the other people that use our streets. And part of what we're doing on Shiloh is to put up the pedestrian signals that are going to be up. They're still on order, but by the spring, we're going to have those up. And the whole idea is to raise that awareness of the pedestrians or bikers that are at those intersections. So we're doing everything we can through the design to keep the awareness between the different modes of travel. And then and I'm not sure if this was the question, but I kind of sensed on the bike boulevard with the percentages, the idea is to get them off the Grand Avenue, off the Broadwaters, off the Centrals, and onto these local streets where people can be more comfortable. And so it's serving the purpose for the people that are driving as well, because now they've got a street that does not have that conflict on it. So that's how we're serving all of the modes.
Okay, thank you very much. I saw a couple more hands. Councilmember Neese. Reminder, we're getting close to 7:30. We'll try to wrap up soon so we can get public comment and take a break. Councilmember Bernice.
Thank you, Mayor. And this is actually to Debbie. When Frank brought up the bike boulevards and the design, Debbie, if I recall, there was two different designs. One that actually blocks the street off and diverts it, and the other is just like a mini roundabout, which I actually would not be opposed to, because I think it calms the traffic, but allows the traffic to continue forward. And like Frank says, if you need to get to the house right on the other side of the intersection, instead of going around the block, you just go around the little roundabout and you're there. So are you strongly considering those roundabout ones, or actually the full diverters where you have to go around the block?
We are looking at all of the different treatments that are used on bike boulevards. The one thing we don't want to do is put something up that just barely impacts the vehicles, because then they will use those neighborhood streets. So we want to make sure that it has enough of an impact that it encourages those vehicles to go to the arterials and the collectors and off the local streets. If it's really easy to drive them, they're going to stay on them. So I think if we do use the roundabouts, we would probably need to put them in every 4 to 6 blocks, I would say, versus more of the 8 to 10 with the diverters. So those are not exact numbers. I just know they're things we're looking at is how that works. So
okay, thank you very much. Just I don't know how the other council members feel about the mini roundabouts, but I actually prefer those over the diverters.
Thank you very much. Yeah, I saw some of those in Missoula the other day. Councilmember Treaky.
Since the policy is kind of being questioned here, I just want to mind, Council, that the reasons that we set this up were stated early in the presentation, but there were also, in the 2011 and 2016 resolutions, and it is both to help promote health and safety within the city. And it is, one of the points of it is actually to get people out of their cars and walking and using more active modes of transportation as opposed to just sitting around in their cars all the time. So over time, one of the measures that will show that we're being successful of this is that the number of people driving cars to one place to another actually is decreasing in there. So if we continue to design things designed for cars and leave other forms of transportation out, then all that's going to do is to continue to enable car as the major form of transportation. One of the things that I see over and over and over again in studies designed for cars is that they are not designed at human scale. One of the reasons why places like Main Street doesn't get good commercial activity is because it's not designed for people to get out and walk. Having bikes on those things, having slower traffic on those things, having sidewalks funding onto the actual stores, all of those things make a huge amount of difference when it comes to actual people actually participating in local commerce. Something like the design of Main Street or King Avenue right now is death to small local businesses. So.
Thank you very much. I would suggest, since it's 7:31, that we open up for public comment. Is there anything from council members that they desperately need to question or say before I do so? If not, this is time for public comment then on item number 2, the Complete Streets Progress Report that you've just heard. That phone number, 237-6196, 237-6196. A reminder to any callers to please turn off your television or your computer because our meeting is ahead of what you're hearing. And you'll be confused if you try to listen to both of them. We'll need your name and phone number. Please keep your comments to less than 3 minutes. That phone number again, 237-6196. Our city clerk, Denise, do we have any phone calls?
No, Mayor, I have no calls.
Okay, thank you very much. I purposely made a long speech there to give people time, and I guess it wasn't necessary. So we'll close the public comment period on item number 2.
Oh, take that back.
Okay, well, we'll give it to him. It was close. Go ahead.
I'm sorry. He has hung up.
Oh, sorry. I hope I didn't deter our caller. For anybody who was listening, if you did want to comment, please send us an email or feel free to pick up your phone and talk to your representative on the city council, or again, send us a letter or email. No other calls then, Denise? So then public comment is closed. 7:33. Why don't we take our break? We'll try to come back here as close to 7:40 as we can. That should be about 6 or 7 minutes. See you then. Let's give him on item number 3. Hey, Mr. Ewalt is with us. Okay, well, thank you. Welcome, everyone, back. We left off with item number 3, our CARES Act update. Andy Zeller will be giving most of that, our finance director. Chris Kukulski, do you have any introduction before we turn it over to Andy?
Just in brief, as Andy gets ready to roll here, we just wanted to present the council with the details of what we received so far, kind of the buckets of those. So that's what Andy's going to be presenting tonight. Some of you have asked for over the weekend a little more detail on the expenditures, so you'll see that included in this presentation. And then, as always, we'll get you the slide deck tomorrow from tonight that'll have some of those numbers in it. So with that, I guess the other thing I'd touch on briefly, the intent tonight is not to define where we'll spend these dollars, but it is to get us thinking that into the future, we're going to need to have those conversations. And a couple of critical points, I think, there is we don't know what we don't know about the future, whether we are going to see this pandemic last for months or a year longer, and what the tax implications would be on that. And then secondly, I would point out that the capital improvement planning process, which we're, as a staff, we've just about got ready to go out to you and the public for review. It's going to come to you specifically in the month of November for a full work session, and then review and adoption, if acceptable, throughout the month of December. That with this being one-time money, that is an area where I think there should be some really healthy debates amongst the council on setting policy as to where to best to invest that money. So with that, I want to turn it over to Andy as he'll cover the kind of details of what we've got and where it's at. Thanks, Andy.
Okay, thank you very much, Chris. So my understanding, the focus tonight is more on the discussion of the revenue side, not the expenditure side, to the extent those can be separated. So Andy Zeller, City Finance Director, it's all yours.
All right, Mayor, Council, thank you. Thank you, Chris. I'm going to share my screen. You all have the slide in front of you. Does it look good? Okay, cool. As Chris mentioned, just an update tonight. I think a lot of the grants you guys are aware of because they come to you at regular city council meetings, but there's one large grant that the city has benefited from through the state, which we've sent you updates on before, but I don't know that we've done a formal presentation, so we wanted to take an opportunity to do that. So the CARES Act allocated a lot of money throughout the entire country. The city of Billings thus far has benefited through, I'd say, 5 allocations that came through the CARES Act. One is the State Stabilization Fund, which is the one that you haven't really seen a lot of at city council meetings. The other ones are direct to departments, the Federal Transit, Federal Aviation, to our airport, Department of Justice, that was to largely the police department, but it was used throughout the city. And then Housing and Economic Development allocated additional monies more recently to a total of $909,000, and that's the community development block grants. You got a survey in your water bill that has helped to identify areas of need for that grant. And I'm not really going to touch on any of the bottom 4 on that list tonight. There was a brief description in the council memo on each of those, but they're more restricted to the departments, Federal Transit for Met Transit, Federal Aviation for our airport, Department of Justice. That one largely we've used for police department protective equipment and overtime costs. And then Housing and Economic Development, we haven't used any of that. They're still identifying eligible areas of need or eligible areas.
Andy, I'm sorry to interrupt, but I think we need to clarify. Although your heading is CARES Act allocations to Billings, the city did not receive $1.5 billion.
No, that's why it's direct aid to the state of Montana rather than the other 4, which were direct to the city of Billings. But we have benefited a lot from the state stabilization fund, and that's where we're going to focus most of our time tonight. In fact, everything after this slide is only on state stabilization fund, because I think that's where we wanted to give you the most update. But you're correct that 1.25 billion did not come to the city. It came to the state, which is a great segue to the next slide. The state stabilization fund allocated money to every single state in the United States with a minimum amount of 1.25 billion. The requirements of those dollars were set by the Department of Treasury. They had to, and I've got the 3 items listed there. They had to be necessary expenditures incurred due to the public health emergency with respect to COVID-19, not COVID-10. I'll correct that. They were not accounted for in the budget that was most recently approved as of March 27th, and that they are incurred between March 1st and December 30th. The December 30th date is kind of key. So that money was sent to our state, and our governor put together an advisory group to help guide the state and give him assistance in decision-making process to allocate those funds around the state where they'd be most beneficial. There were 24 members made up from all around the state. The city of Billings was represented by the Montana League of Cities and Towns on that advisory council. There are, I believe, about 15 or 20 grants that have been created. And I've got a link. Anybody can go there and see what grants exist for the state of Montana that they may be eligible for. In fact, I would encourage anybody watching that may have to go look at that and read the list. There's one grant that was the local government reimbursement program that was created, and that's where the city of Billings where we've received money through this. The local government reimbursement plan is administered through the Montana Local Government Services, and they have taken additional guidance provided by the Department of Treasury to set out what is eligible for reimbursement under the state stabilization funds. And these are medical expenses, public health expenses. This is the big one, all regular and overtime pay, including benefits for first responders, public safety, and public health personnel. You see, I have those are through March 12th through August 31st. They keep extending that deadline or the eligible timeline. As of Friday, it was only through August 31st. It's highly, highly likely they will continue to extend that month over month until we hit December 30th. But as of right now, it's only for the costs that were incurred March 12th to August 31st. We can also seek reimbursement for other employees who are not first responders if their regular and overtime hours are substantially dedicated to mitigating or responding to COVID-19, and expenses to our facility to comply with COVID-19 measures. So what does all this mean for the city of Billings? Well, through that time frame, the city of Billings has incurred $13.6 million in eligible payroll and benefits for first responders. We've had about $10,000 in employees who are who met the definition of substantially dedicated to responding to COVID-19. We have a few library employees who are doing contact tracing, and so it's 100% of their wages. We also had some additional facilities employees for increased cleaning, City Hall, so their overtime and additional time is eligible. We've had a fair amount of PPE or personal protective equipment, cleaning supplies, and we've paid some contractors to come and do some deep cleaning at times, especially when we've had a known exposure in public buildings. We've made modifications to City Hall or to city buildings, including the library. It's currently undergoing a modification to allow for socially distant meetings to occur and also be broadcast via Community 7. So we're taking some opportunities there to enhance that room. And then we've purchased a lot of computers and software to allow employees to work remotely. So the non-payroll expenses, these are costs that I would say, the city's incurred that were largely unplanned during the budget process, and you'd likely see a budget amendment for these items in the future. As we stated earlier, most of it is laptops and computers and software to allow people to work from home. The AVI installation at the library community room, the contract cleaning services, and then the additional PPE. A total of about $124,000. And as I've got noted there, we'll likely be bringing a budget amendment for these items. Additional COVID-related payroll costs. These I've kind of isolated from the 13.6 million down to what I've I don't know what the right term is exactly, but I would say these are additional costs to the city as a result of employees having exposure to COVID, either exposure or contracting COVID. We've had COVID overtime of about $46,000. This includes when someone gets sick, if needed, if we have to have minimum staffing and we bring people back or backfill in with overtime costs, that would be there. This would also be overtime costs, like I've noted, for additional cleaning or even just prepping and creating plans. There's also the Emergency Paid Sick Leave Act, which required employers to provide up to 80 hours of paid sick leave. If you were a private industry, this was reimbursed by the federal government, but local governments were not excluded from the act, but we are not eligible for reimbursement. So these are regular pay. We continue to pay people's salary for up to 80 hours under this Emergency Paid Sick Leave Act that we actually aren't eligible for reimbursement for. But these are regular payroll costs that we budgeted, and that's about $117,000. Total of $163,000 there. So if you think back to the eligible costs we've had that I've broken down, 13.6 million, mostly first responder cost. This is how it broke out for our request from the state. Back at the end of June, we made our first request, and at that time it was for eligible costs that were incurred from March 12th to May 31st. We requested and received $4.2 million. The second request, they expanded one more month, and we requested and received just under $2.2 million. And the third request, they waited a little longer. They expanded 2 months, and they expanded the eligibility of expenses to include the benefit cost to first responders. Those first two requests did not include benefit costs for first responders. It was only regular and overtime. So that's why it's substantially higher, as we were able to recoup benefit costs all the way back to March 12th. We haven't received that check yet, but that request was just made on September 23rd, so not too long ago. Fully expect to receive that rather shortly. You see they have a pretty quick turnaround there. So total so far of $13.7 million. Again, as I stated earlier, I fully expect this number to go up all the way to December 30th. And that's just assuming they continue to allocate dollars of the $1.25 billion to this grant. And all indications are that will continue, but I just want you to be aware of where we're at today and some expectation of the future. So what does this mean? As Chris mentioned, not necessarily here to discuss and prioritize the needs of the community today, but certainly we'll be doing that into the future through the CIP process, through your priority and goal setting process held in the early part of next year, and then through the budget process. We'll want to develop some sustainable plans for the future use of these funds. As Chris indicated and reminded, these are one-time dollars. So going out and hiring a bunch of staff probably wouldn't be a good way to use the funds, because those are continued long-term costs. And that you will, and I want to remind you all that you will be approving the funding either through future budget adoptions or through budget amendments where appropriate. But you, City Council, will have the final say on eligible use of these funds. And I think with that, I'm going to end my slideshow and we can discuss.
Very good. Thank you, Andy, for that nice, concise presentation. We always appreciate good news. Councilmember Ronning.
Thank you. Hey, Andy, so I have a question for you. When we received a report from Kevin Plone from the airport, the number he gave us that we received from the CARES Act for federal aviation was 12.7 million, but your slide says 13.5 million. So did we get additional funds? I'm assuming we got additional funds then after that?
That is correct. We got an additional 821,000, I believe it was. And then it was only to be used for capital. So it will go to capital costs.
Okay, thank you.
Thank you very much. Councilmember Shaw.
Thank you. Chris, this is a question for you. When will the report from the Center for Public Safety be ready? I assume that will be part of all of these discussions, so I'm just curious about the timeline.
So they're doing their data analysis as we speak. They've gotten quite a long ways, particularly on the law enforcement side. Then I believe the kickoff meeting on the fire emergency response side was last week or in the last couple of weeks. So I think we're thinking that late in 2020, so the maybe December period, we'll start to see some information back from them. We've indicated to them our goal is to go into the new year setting goals, creating a budget, and possibly future public safety levy information with this information in hand. So I think we're looking at full report in the winter and late fall, us starting to analyze the information they're providing us back.
So we'll have enough of that information to bring it into this capital investment conversation then. Okay, thank you.
If I could add briefly, I don't know if it'll be timed enough for your first work session on the capital improvement plan, but absolutely it will be as we get into next fiscal year's budget development and priority session.
And thank you. Andy, can you just confirm then there's no deadline for expenditure of these funds, even though, of course, they were tied to specific time periods? Is that correct?
So for the state stabilization funds, the expenditures have already occurred. If you think about it, our grants, we pay the eligible cost up front on any federal grant and then get reimbursed once we've expended the funds. So we have incurred all of the eligible costs at this point. We are being reimbursed for those. And we will, at this point, only be reimbursed for eligible expenditures that occur up to December 30th, if that makes sense. The other grants do have some timelines, I can't say definitively that they have to use those funds by, but it's multiple years. But for state stabilization, we have already met the requirements on those.
Thank you very much. That means there really are no further strings attached with the expenditure of those funds.
Presently, that is the case and the understanding.
Okay, thank you. Councilmember Chiriki.
This isn't a question, it's comment. I just would ask council to not, oh shoot, I can't think of the phrase, start counting our chickens before the eggs hatch or the eggs are laid. This pandemic is far from over, and we have no idea at this point what the economic impact is going to be for our budget next year. So I personally will not support spending anything until after vaccines have been widely distributed and found to be actually useful, and the numbers are showing that the pandemic is no longer impacting us here in Billings. Thank you.
Good reminder, Councilmember Neese.
Thank you, Mayor. Andy, I want to clarify some things that I think I either read or heard you said. The the money has been mostly put into the public safety fund. Did I hear that correctly?
That was in the memo. Yeah, that's correct. We put the funds back to where the eligible expenses occurred.
Okay. And so if I understand this correctly, our revenue to pay that public safety expenses initially came through the taxes we assessed to the residents. And now this money is being reimbursed to us by the state. And so we've received the money from the residents, we paid the expense, and now we're being reimbursed by the state. Would we not want to give a break? Again, I don't want to try and speak on expenses, so where we use the money. But do you see where I'm coming from? It looks to me like we're getting paid or getting revenue for the same expenses from two different locations. Is that? Do you see that where I'm seeing that we're getting revenue from the people through the taxes, and now we got the same revenue for the same expense for the people from the state? Do I understand that correctly?
Yeah, I think you're on the right track. I mean, we have the public safety mill levy that pays for largely public safety salaries, and then we've been reimbursed because those were eligible expenses.
Okay, and Mary, and a quick follow-up, also clarification on the public safety mill.
Sure.
Okay. Andy, when we talked about I think this was discussions during the budget process, we talked about reserves, and I believe you said the only reserve was in the general fund, not in public safety. So if this money is now placed in public safety, does that mean public safety has a large reserve?
No, it means less is transferred from the general fund. I mean, we can set a reserve policy for the public safety fund if council desires, but it's really unnecessary, as the general fund holds reserve and substantially funds the public safety fund. So what ends up happening is less is transferred from the general fund.
So does that make our general fund reserve much larger then?
It does. Yes, it does.
Can we get that number?
It's 13.7 million presently.
Okay.
Higher than normal, but we'll have first quarter budget reports out probably in 10 to 15 days.
Okay. All right. That's what I wanted to know. Thank you very much.
Thank you. Other questions for Andy or staff? Councilmember Ewald.
Thank you, Mayor. Andy, you said that last $7 million addition was pending. Does that mean you just haven't got the check yet, or they haven't agreed to paying us that much yet?
So the way it works, we submit. Short answer, what it means is we haven't received the check, but they also haven't approved the expenditures yet. We submit the list of expenditures, and then if they have any questions about it, they'll email us, and we provide backup documentation. I think all of ours have been approved in the past, with the exception of less than $3,000, and it was due to a timing issue. So I fully expect we'll see the full amount of that.
Okay, I just wasn't sure.
Thank you very much. Councilmember Ronning.
Thank you. Chris, this might be for you, but it might be for Andy too. Chris, at the beginning of the meeting, when you were giving a report on COVID, you had said that I think there were 23 city employees that had tested positive. And then you made a statement that said there were over 100 people that had to be quarantined as a result of those city employees testing positive. So my question is I guess kind of twofold, but were those 100? I mean, how does that? I guess I assumed when you said people, they weren't other city employees that had to be quarantined. But in the event, in the slides that Andy presented on payroll costs, so how does that work if a city employee tests positive and they've come in contact with other city employees? Have there been situations where, you've had a number of city employees from the same office that have had to be quarantined, and how does that work?
Councilmember Ronning, Mayor, what I would say is, so just a reminder. So we've had, of the 940 full-time employees, 23 have had positive tests at some point over the past 6 months. And yes, 132 employees have been quarantined. So we're following our protocols guided by Riverstone Health and the CDC to determine who needs to be quarantined when we have a positive test, or when we have an employee, particularly a first responder, come in direct contact with someone who is positive. So all of those rules are guiding the quarantine individuals so far. So I would anticipate, based on the uptick in numbers, that we probably would see these numbers all rise over the next 6 months. And therefore, there is a cost to us that we are experiencing. Now, we're getting it fully reimbursed, particularly on the first responder side, exceedingly well. So to answer your question, does that answer your question, Councilman Ronnie?
Yeah, and it was related also, and my apologies, I may not have asked it really well, but it was related to when those cities employees go into quarantine. And some of those employees, their job is not working at home, and it doesn't equate to being able to work at home. They might not be an employee that can work off of a computer or a phone or something like that. I'm assuming that the city still pays them their salary or their costs during that time. Did I understand that correctly?
Yeah, so we're following also the federal rules about that first 80 hours in the Emergency Family Medical Care Act. And then I don't know if we've had anybody use any of their own sick leave beyond something like that. But I'm not aware of any employee who has a loss in income because they've been quarantined or tested positive through the city.
Okay, thank you very much. Councilmember Tricky and then Councilmember Deese.
I want to amend my previous remarks. After thinking about it, I think that the two areas that I do think we need to be thinking about spending some of this money on is additional police officers and setting aside anything that we may need to spend in terms of any other first responders in this crisis. Obviously, the crime rate has just been going crazy recently, and I suspect that we need more people on the streets.
Thank you, Councilmember Bernice.
Thank you, Mayor. Although I could talk a lot about where I would like to spend it, I'll wait for that discussion, Chris, when you bring that to us. But Andy, I do have another question for you, if you don't mind. Assuming, and again, we assume you said you fully expect that we'll get reimbursed through December 30th. I don't know why not the 31st, but 30th is what it is. If that happens, and I won't hold you to it, but if that happens, what would you expect that the excess reserves to be at that time?
So as long as nobody from the public's watching any longer, we can. My guess.
The number won't be quoted in the paper. Don't worry.
Yeah, I know. This is off the record. My guess is that the total reimbursement, if things continue as they currently are through December 30th, will exceed $20 million. Okay. Significant portion of that being public safety salaries.
Right. Okay. Thank you very much.
Yep.
And just to clarify, that's the cumulative total, not new money in addition to what you've already said.
Correct. Cumulative total. Our speculation is 20 to 23 million. There's also some discussion that they may extend the deadline, but that's set by the Department of Treasury at the federal level, not locally. So that will change things again if that happens.
Thank you very much. Other questions for Andy? It looks like conversation is getting close to wrapping up. If members of the public are watching, we'll open up for public comment real soon, and that number 237-6196. So be prepared to call. Chris Kukulski.
So I'll do another commercial fill-in while we're waiting for the phone to ring.
Okay, if that's the case, I'll go ahead and open up for public comment. Go ahead and people can call 237-6196. We might keep you on hold for a couple minutes while we finish up this discussion. But Chris, go ahead.
So clearly a big thank you, right? Nobody wants to be in this situation with this pandemic, but your staff is not sitting back. Tens of millions of dollars are coming into the city, 10 plus so far, between Andy's team, Kevin Plone's team, Wyeth's team and the community development side, and then dangerously, I'm sure I'm missing somebody else. Everyone in this organization who is tied to paying attention, hey, is this a cost we're incurring that's eligible for reimbursement? They're doing that work. And I want to thank them for continuing to do that, because Billings isn't just sitting off on the sidelines saying we've got it covered. We're out there trying to make sure that the citizens of Billings are playing by the same rules that the federal government is setting up and the state of Montana is setting up. And that hopefully is helpful for our businesses. A plug for tomorrow. We have the Restart Our Business. I'm not getting the name right. Reopen event for Big Sky Economic Development. Mayor, can you help me on what that's called?
No, but I know what you're talking about. That's right.
So late in the afternoon, yeah. So we've had dozens of our businesses in the community volunteering their time to put this plan together, and many city employees across multiple disciplines trying to figure out, very engaged in this conversation and making sure that we're getting to have this discussion we have tonight. So I want to thank each and every one of them.
It's the economic response and recovery plan.
Thank you.
Yeah, that's a mouthful. And I think it goes, it's important to say, mention our public safety mill levy that recently passed. Here we are looking at what are millions of dollars that have come in from the federal dollars, but the voters just approved the public safety mill levy. Why did we go ahead with that? The truth of the matter is we didn't know these dollars were coming until relatively recently. And we knew, we had this discussion, we've always been transparent with the public that we expected these dollars once we found out about them. But these are one-time dollars. The public safety mill levy is a permanent fix for a long-term structural deficit. So these are great, I don't want to call it a problem to have, but a great development. But just we want to acknowledge we're still appreciative of the voters for having approved the public safety mill levy, because that will solve a lot of our funding problems permanently, where this is a one-time boon. Let's again, we've opened up for public comment on item number 3, this CARES Act update. For anyone who's called 237-6196, 237-6196. Feel free to call that number. Please keep your comments to less than 3 minutes. Tell us your name and your address. And please turn off your television or your computer, because the meeting is ahead of what you're hearing and you'll be confused if you're trying to listen to both. Denise, did anyone call 237-6196 to comment on this item number 3?
No, Mayor, I have no callers.
Okay. I think we gave a fair warning. So we will go ahead and close the public comment period on item number 3. Obviously, we'll need to have a lot more discussion about this item. Staff will keep us up to date on both the revenue side and also start to structure the discussion on the expenditure side as we go forward. With that, I'll move on to item number 4. If there's no final wrap-ups, I'm seeing a couple waving hands. So Councilmember Tricky and then Councilmember Neese.
I think we need to have a conversation about whether or not we ask staff to increase the staffing in the police department at this point. The amount of crime that's going on right now is very disheartening, and the type of crime that's going on right now is very disheartening. And I'm pretty sure that the police department is incredibly overwhelmed at this point. And I would personally suspect that one of the reasons for this money is to deal with exactly this type of situation that's going on right now. So I personally would like to see us at least discuss it. If you need me to make a motion in order for that to happen, I'll do it, but I'd rather have a discussion first.
Sure, and I don't think we would want to be heard to be ruling that out. The question is whether we get into that tonight without much warning to the public or to ourselves, or ask staff to put that on the list and give us their input. Chris Kukulski, do you want to comment on the substance of that very important issue, but also the timing of it?
Yeah, I certainly, it is speculative. It is a concern, I'm sure, for all of us. I would want the chief, where I would start is I would have both chiefs pull together the data that they've seen over this first quarter, maybe the last quarter of last fiscal year. We are analyzing part of what the Yellowstone Substance Abuse Connect, what the resources are that they're dealing with. I'd have us come back to this body with this discussion, with recommendations or kind of talking points from the two chiefs, guided by the two chiefs and myself. And yes, I think it is alarming to have Mr. Ifland and I talk about, is it 12 homicides this year, or is it 14, or is it 15? These are numbers that are way higher than we're accustomed to. And so part of our analysis also is, what does our overtime look like in the police department, just directly related to those crime things that you can or cannot say is a direct COVID cost. So those earlier COVID numbers in payroll were directly tied to someone who tested positive, or someone had to fill in a shift for someone who was missing. That doesn't relate to all the overtime I'm sure we're experiencing as a related crime rate. So I would ask that we schedule that. I think in light of what we've got coming in front of us, it might mean before Christmas, a special work session, because I know we've got a full night of work session or more set up for Project Recode, for the capital improvement plan, and for those are the two big ones that are coming here in the next 60 days that are very, very significant. So that would be the approach if the council's inclined to have that specific discussion.
Okay, thank you. We'll go back to Councilor Brown here, but what I'm hearing, Chris, is you're setting the signal that even though you mentioned capital improvement plans, kind of one-time expenditures as being your preference for some of these dollars, you certainly have not ruled out something that's more operational, focused towards policing and crime mitigation.
I think that's true, particularly as it relates to where we're getting this money from the state of Montana. So,
okay, thank you for that clarification, Councilmember Brown and then Councilmember Trickey.
Thank you, Mayor. Obviously, I know that Chris and everybody understand we just kind of got out of that quandary. Hiring personnel out of a reserve, and everybody was just going nuts on that. So now we're visiting again about doing the same thing. So just a cautionary warning, I guess. And I know that Chris would be on top of that. But
Thank you.
Yeah, thank you. Councilmember Trickey?
I understand that, but I also believe that we're in an emergency situation right now. And in my opinion, getting on top of and slowing down the violence that's going on in our community right now is a lot more important than our capital improvement plan.
Okay, thank you. Good point. So my interpretation of Councilmember Brown's is, Chris, one thing to be given consideration is not just how to start spending dollars, but perhaps how to stop spending those dollars at some point in the future, or substitute some other source of funding before we just replicate the problem we've had of namely using reserves for short-term or for operational expenses. Just a reminder, we are trying to wrap up on item number 3 to move on to item number 4. Anything else before we do so? Okay, we've had public comments, so we'll move on to item number 4. Expectations, obligations, quad. This is introductory matter by Chris Kukulski, our city administrator. Chris, it's all yours.
Thank you, Mayor and Council. And the idea here was just to plant some seeds of information, see what kind of dialogue, if anything, you guys wanted to have about it, and determine if we come back at this or you never want to have this conversation again. So let me pull up, if I could, I'm going to share my screen, pull up the information that we've got. And let's see here. Sorry, if you'll be patient with me. I am not get too many things open. So let me, yep, here we go. There it is. Let me expand that. All right, let's try this again and see if it shows up a little bit more legible. There we go. So in the packet, and this is the first time we've talked about this at all, but some of the work that I've reviewed in the past and done with councils has to do with this idea of bringing some clarity and having a conversation between elected officials as to what they see the obligations and what their obligations and expectations are of the senior staff, and the senior staff having that same opportunity to identify those components for council, and both groups kind of working together, and really what can come out of that in the dialogue in clarifying the expectations. I think it's a part of a broader conversation, frankly, and the council talking not only about what the goals are for the next year, but really what's the vision that the council has for itself as a policy body and for the city long term. So rather than me kind of drone on about it, hopefully you've had a chance to read it. Hopefully you found it to be interesting. And I would say we probably should limit ourselves. It's 8:24, which is about perfect for a good, effective meeting to run about 3 hours. Maybe we take 10 or 15 minutes if there's that much feedback to be provided. And I really want to hear from the council. Do you have an interest in having these kind of conversations and ultimately identifying this kind of work to help improve the performance of our staff and of our elected body as we continue to move forward? So with that, Mayor, I will stop sharing my screen. Ultimately, this first sheet is what we would potentially create if the council's inclined. And I would say it's a little bit of a less is more. If you've got 8, 10, 12 things in each of these boxes, it's pretty hard for anybody to follow that. So that's why I deliberately kind of stuck 5 bullets there as just talking points. So I'm going to stop sharing, and we're all back up on the screen. And you're not going to hurt my feelings if you say, Chris, I never want to have this conversation again, or I'm really curious what you guys are kind of thinking.
So Chris, can you just clarify for us, if we say, yeah, that sounds interesting and useful, what would we do? What would be the process? And I think you've already said what the goal would be, which is that one sheet with 5, 6, 7 bullet points under each one. Is that the ultimate goal? And how would we potentially get there?
It is to identify those things and be in agreement as a policy body as to what those look like. What the process would be, I would approach it myself, facilitating the conversation. Maybe you wouldn't want that. Maybe you'd want me to bring someone in from the outside. But I'd say we need a facilitator to help that conversation. And I would say, to make it productive, you also need to include the senior staff. They don't get to dictate what you want, but I think you want to hear from them as to what they're thinking, as the quad deliberately sets both teams' kind of obligations and expectations to one another and to the public. So we have a crowd, right? We got 11 council members, and we have 15 plus or minus senior department staff, with Kevin and I included. So it's a big group. I'd bring that group together where that would be the focus for at least maybe some limited period of time, an hour and a half, some workshop evening, sometime between this winter or this late 2020, early 2021. Thank you.
Okay, thank you very much. Councilmember Brown has hand up.
Yeah, I guess, Chris, could you clarify a little bit more to me why we would be doing this? Is this something that you're not feeling you're getting what you need to do your job? Or I mean, long council sessions is completely different than kind of what you're talking about here. So
I think it is, although I think it directly ties into the effectiveness of our memos to the council, our written material to the council. And I think it does have an effect as you look at the material of the effectiveness of the policy body. So this is not to say what we're doing is horrible. Staff's wrong, I'm wrong, you're wrong. But it is to say, you know what, I think we can do better. And here's some conversations that might help clarify that, to set a clearer target from you to me, for me to the staff, and for you to each other, relative to how we make decisions and move forward.
Councilmember, thank you. Councilmember Tricky.
In my somewhat lamented life in corporate America, I've been involved in a number of different types of evaluations, including probably most valuable 360 evaluations, meaning you get feedback all around. And the one thing consistently that I found to be the most important thing is to have very clear expectations for everybody on the table when you go into it. And I think that is one of our problems right now with the length of meetings and how things are going back and forth. And so if I can see this as being a very useful exercise in trying to clarify those expectations and making it easier for everyone to move forward. Thank you.
Thank you. Councilmember Ronning and Councilmember Shaw.
Thank you. So this is interesting, Chris. I don't know exactly how I feel about it yet, because I think that, I guess the way that I look at this is, we're definitely talking about government. And for me, there was a very important group that I didn't see listed in it, and that's the public. And I guess part of that conversation, that if we did move forward in this, I guess I would like to have addressed also how this government, what the expectations are of the public with this government, and how this government responds to the public, and how that communication happens. To me, that's the most important relationship. But that's my feedback to you.
Thank you very much. That might have to be a separate process, because that might be a handful. But I don't want to prejudice anybody on their thinking on that important point. Councilmember Shaw.
Councilmember Vining, I agree with that. I think that's really important, especially for council. I think maybe not as much for staff, so I can understand why it hasn't been a part of the quad, but I do think it'd be critical. Without going into all of the details of this, I just wanted to say I definitely support us doing some work like this, and I'm really hopeful that it will help us be more efficient in our meetings, if for nothing else. So I think if not this, we need to do something as a council. I think we need to. So I'll keep advocating for that, but I think if this can serve that purpose, great.
Thank you much. Other input? Councilmember Brown.
You asked for opinions, so I don't see a huge need for this. My concern kind of runs along with Penny. This is government, and we're elected officials, and we're elected because of our opinions, because of our thoughts, and we're never going to all agree on anything. I just don't believe that. It just kind of is the way it is. If there are expectation issues and things like that, I think we need to delve into that. There's no way I would not agree to that. But I think just the bullet points that you had, be respectful and, support what's been voted on, those kinds of things. I think as long as we're doing that, we're kind of meeting our expectations and really sticking up for our constituents. That's why I asked Chris is, if there really is, something that you're like, gosh, I just don't get what these guys want. So it's really hard for me to give them what they want. I support it 100% to try to get that figured out. That my opinion.
Councilmember Purington.
I'm going to ditto what Penny said and Sean said, and I think Kendra said it in a certain element of what she said. We are elected, and we're elected for a reason, and we do have different opinions, and it's great when we can converge and agree, and we have done that. So I think that's important. And I thought as well about the bullet points, as Sean brought up, to be respectful of each other. And I was even visiting with a former council member, and just the respect that you have for each other, calling them by their last name, not interrupting, which, I don't think we interrupt at all. But I think it's just, I have seen your frustration, Chris, from even before I was elected, all but throwing your hands up in the air going, I don't know what you want. And, and I think that's part of your job as a city administrator, to learn how to maneuver that. And don't ask me how you do. I would not have your job for anything. But I think the availability that you give to each of us is great. The response of our senior staff, I think they're amazing. And not that I always agree with them and their perspective of certain things, but they're respectful, and I appreciate that. So I think that's part of who we are as a council, that we serve the public and we serve them as well. So to take a lot of time with this, I think we'd just be going through the motions, if you will. But I think there are times that we need to be reminded of that just ourselves. And I think you giving that to us to look at it, it was a place that I was anyway. So it was fairly well received. I mean, there were some elements that I'm just going, but that's my opinion as well. So I don't know at this point, especially this late in the game, that there are so many important things that we need to look at right now. I appreciate the things that Danny was saying about the crime in Billings. And I think to address the crime before we address recode, I think the public would appreciate that. And I'm not saying we're spending the money for that, but I'm just saying we need to look at it. We need to see what we can do. So those are my opinions.
Thank you very much. Other input for staff, Councilmember Neese.
Thank you, Mayor. I actually agree with Councilman Brown and Councilwoman Parrington and Councilman Morani regarding both the public and really I see us doing a lot of this. I believe there is a lot of respect for each other and the staff. It is, we will disagree and we will vote against each other. We will support our opinions and we'll support our constituents in the city of Billings. But, if there are issues, Chris, that you see, feel free to pull us, talk to us. Any of the council members talk to us. I think that's it's always good to have this list. As you said, as I read through the list, I see a lot here that we do. And so if, again, you have good staff, we point out the issues in the memos and they correct them. And so I think overall, I don't see a need for this right now.
Thank you very much. Chris, my input would be that I see the value if it doesn't become either something that was a huge time sink or because of a lack of direction, just a lot of opportunity for general discussion that might create hard feelings. So I think that could potentially be avoided, or we can talk about this offline, but I wonder whether this could be done with kind of a ballot. The people could be done on their own time where staff would come up with a list of 10 or 15 options in each of these. You've got great materials here. And then submit that to the council, see if anybody's got any other things that add to each of those categories. And then we would have a vote, and you'd have 5 votes, and you could prioritize, and then you collect those votes, and then you see, based on that voting, what is important to different council members. And then you would score those. And we might have 10 bullets, but only each one would have a different score. So anyway, there might be some process to do it that could be done without having to spend a lot of time at a meeting, but would still be helpful to you and helpful to staff. And we, of course, could refine that in the future as well. But it might be an easy first step. It wouldn't be too time consuming or difficult. Other input for staff, Councilmember Joy.
Thank you, Mayor and Council. And well, I think it's I like it. Of course, I work at a school, so expectations, it's all about expectations and responsibility for behavior. So that's what I do all day. So I'm like, hey, this looks very familiar. We do have to be responsible for our own behavior. We do have to show leadership. We do lots of we do's for our council as elected officials. And I would like to say something a little bit about elected. Some of us got elected by maybe 200 votes more than someone else. Of the total percentage of the city of Billings, very few people are voters. So if you want to say, I represent the people who voted for me, that's a very, very small percentage of the people in this city. That's not an overwhelming majority of anything, because very few people vote, and the difference between votes in most of our elections is a couple of hundred votes. So does that, to me, that's one thing that I always try to keep in mind as an elected official. Yeah, I'm elected, but not by everyone. I'm not elected by a huge majority. I'm not I haven't been elected of a majority of anything. So I always try to keep that in mind, because that's a little limit on what I think of as my power. That's a kind of ego buster itself. And I'd like to also talk a little bit about some of the issues that are brought to council that we as city elected leaders should be taking on. I'm going to talk about race. We've had many constituents, people come forward and say, we want this council to address issues of race. If we can't discuss things among ourselves in a way that's conducive to problem solving, how can we show leadership to have hard discussions within our community about things that are really tough, like racism?
Your Honor, getting way off topic here.
But hopefully, Councilmember Joy can make that relevant to this process.
Absolutely. This process is about expectations. This process is about how we relate to each other. How when we get to difficult decisions like the budget, how we relate to each other. How do we take that we have to do, the relationship that we have with each other, and how do we apply that to the public, to our constituents? So that's my comment. If we as a council can't talk about tough things that are happening between us in council, our ability to represent constituents' concerns that are very difficult is very limited. Thank you.
Okay, thank you. Other input for staff before we go to public comment on this item? Anything else? Anything else? Looks like we're getting close to public comment. So if somebody is listening and they would like to comment, that phone number again, 237-6196, 237-6196. We'll go ahead and open for public comment. We'll carry on our discussion in case people want to call in. Ask you to keep your comments to 3 minutes. Chris, I'm not sure we're giving you a lot of detail here.
No, that's okay. I think, sometimes, and I'm not very good at this, but sometimes you just put the question out there. See what the dialogue is. You guys got to hear each other. So please don't try to read too much into it on my end. I'm not trying to point out that there's something wrong or there's something right, as much as I was curious what you would think. And maybe it was a more appropriate thing to stick in a weekly and say, hey, take a look at this. So based on the feedback, unless I hear differently from my staff, I think it just sits where it is. You guys you've seen it, you know what it is, and be conscientious of it as we move forward. And it wasn't trying to point out something wrong or something right. So thank you.
Okay, thank you, Chris. One thing I heard clearly was if there are specific issues that you want us to advise you on or discuss, you always have an open door and invitation to bring that up very specifically. Okay, that phone number again, 237-6196 for any public comment on this item. Denise, did anybody call 237-6196 for comment on item number 4?
No, Mayor, I have no callers.
Okay, we'll close then public comment on item number 4. And next item up is items of general council discussion before we go to public comment on non-agenda items, things that were not on our agenda tonight. Are there any items of council discussion? Councilmember Ronning.
Thank you. This is, I guess, a question for Denise and for those of us. So this week we have the National League of Cities and Towns convention. And I'm not sure how many council members signed up for that, but I know it's virtual. If Denise could walk us through, or maybe it's Lynette or Chris or someone, and I know it starts tomorrow, and this can be in an email because I don't know how many council members signed up for it. But and Bill, I know that you're involved, but are there any opportunities for the public to participate at all that you know of? Because I haven't seen the agenda. And then also if someone from the city staff could tell us how we actually watch this thing where it's not on our mobile devices. I haven't been able to figure that out. So that can be done offline, but wanted to put that out there. And if there is an opportunity for the public to participate at all, can that be put on the city website or something? Thank you.
Denise, maybe you can address a lot of those issues.
Yes, Mayor and Council. I will visit with Lynette in the morning. She was responsible for signing up council members who are interested. I have signed up, and I did receive an invitation with the app. And it said in there not to share the link with anyone else. So it kind of sounded like maybe they weren't opening it up to the public in general. But I do have a contact person, and I can certainly forward that information out, and we can ask more questions first thing in the morning. Okay, all right.
Yeah, and for any council members that are registered, you should be able to go to the Whova website and access it through the Whova website or also their app on your smartphone. Kevin Iflin, you turned on your screen. Did you want to educate us about anything?
Well, thanks, Mayor and Council. I was just going to point out exactly what you pointed out, and you just use your email address, and then you should have a password or something in the link that you were sent, and then it does have the full agenda on there, and you just click on View Session when the session time comes up if you're interested in attending that. As far as the public portion, I'm not aware of anything generally open to the general public.
The other plug, if I could, Mayor, and I've only attended one other full virtual conference. Our international conference was virtual about 2 weeks ago. I was pretty impressed. When you download this, it does look to be like a very sophisticated, user-friendly. Ironically, I don't know if those go together, but I think this day and age, in order to be quality, it's got to be easy. And it's WHOVA. That's the name of the app, and I think when you download it, it's pretty impressive. And the staff was very enthusiastic at MLCT about how they think that this may, especially for those little towns who sometimes can't make it or their staff can't make it, that this may really open up opportunities for them, as well as those of you who can't leave home to go to the conference. Remember, we would have been in Kalispell. So we would have had, an 8-hour one-way drive to get to this conference. Now you can do it from your home. So take a peek at it.
And it is cost effective. So if any council members have not registered, work with Wynette to get registered, and don't feel like you have to attend every session to get your money's worth. If you see a few things that are of interest, that's probably worth it as well.
Thank you.
Very good. Thank you for bringing that up, Councilmember Ronning. Councilmember Trickey.
Yeah, before we close tonight, I would like to make a motion to ask staff to do something like perhaps engage a PR firm to develop, coordinate, and implement a public education campaign designed to slow the spread of the COVID-19 disease. But before making such a motion, I am open to having a conversation about what that should actually look like at this point.
Thank you very much. It's certainly an important topic. We do have a conference call on Wednesday coming up. Chris and I do with the heads of the hospitals, and Chris and I have already talked about this item being part of that discussion, how we could coordinate some sort of campaign. But we would have to pay for it. There is the question of reimbursement. If there's anything that should be reimbursable under the CARES Act, that should be one, I would assume. Councilmember Brown?
I know there's some other groups out there that are trying to do some of these educational things too. Big Sky Economic Development Group and, the Chamber and some of that kind of stuff. I agree with Councilman Chiriki. I think that's a great use of some of that money. It's literally going to be a drop in the thimble, compared to the 13, possibly $20 million. And I think it's certainly worthwhile, but it might be worth getting a hold of some of those guys that have already done, all that marketing work. And now we're just trying to figure out how to get it out there in mass.
That would be my inclination. We're better off working together than doing separate efforts, but that's just my thought. Councilmember Neese?
Mayor, I fully agree with you that we'd be working together. If they've got a campaign they're working on, they've already been maybe looking at what they're going to do. And again, if we contribute a little bit, but then it's reimbursable, we can sure ask Andy if that's additional funds that we can request for reimbursement. I don't see why we wouldn't do that.
Andy, are you still with us? And if so, can you comment on our ability at this date to seek further reimbursement for that kind of effort?
I had thought about this a little bit. It sounds like it probably would be eligible. And if it were any funds that were spent, meaning the city had written the check by 12/30, would be eligible. Entering into a contract that you haven't paid on yet doesn't count.
Okay. Anybody want to oppose that approach? And obviously we don't know costs. I guess what I would anticipate is that we ask staff to investigate this with some of our partners, come back with cost information. Presumably there would not be an emergency that we'd have to pull the trigger between now and our next meeting. But Councilmember Tricky and then Councilmember Ronning?
The one thing that I would say is, having been sitting between a number of different organizations trying to organize and coordinate things like this, it is really important to have someone who's responsible for coordinating that. And all of the organizations we're talking about right now are busy as heck, which is why I think engaging a PR firm to be the central point in all those things would be a very useful thing to do at this point.
Okay, I agree. Councilmember Ronning?
Thank you, and I agree with that too. Do we have and I would encourage that School District 2 be a part of this conversation also. Do we have a meeting, a quarterly meeting coming up between school district, city, and county? It seems like we're due one at some point in time. If that's a conversation that needs to happen, then also can that be put on the agenda possibly? But I would really encourage that School District 2 be brought in and part of that conversation.
Thank you. No, excellent reminder. We haven't had a quarterly in some time. We have, as administrators, school superintendent, myself, others, we have been meeting on a regular basis. In fact, they're involved in our policy call this Wednesday, along with the CEOs from the hospitals and John. But I think that's a good reminder to get back, even though we're virtual, to have a joint meeting. And that's one point. The other point you point out is when we look at the partnerships for the ad campaign, for lack of a better term, school district is a wise invite there. I'm also seeing 31 days from today, if that's right, or 30 days from today, there's going to be slightly more airtime. And so, yes, I will approach it based on this feedback, frankly, telling them we as a city think it's time to put some money on the table. That's not tens of thousands of dollars, but real money to be a partner with their money, to have somebody professionally help us message this and move off the dime, because we've all talked about it and done various things, but it's time to maybe move forward in this regard. And I can bring it back to you for your approval, if you will, if you want to set a dollar limit or something on what our contribution would be.
Okay, thank you. Councilmember Purington.
Thank you, Mr. Mayor. I'm just going to, I can see doing a PR piece, but I will say that the city has already spent money in putting together the library, the community room. They've used, they're using COVID dollars to do that. And it's with the intention of meeting in person, yet there are some on council that, regardless of the masking, the social distancing, the cleaning, and the hand washing, that they still don't want to meet in person. And, and I respect that, that's fine, but I'm just saying we're using this money to do this, and yet we're not going to, I don't know if we're ever going to get to use it. Now it's been pushed back to December. And so and I've heard from several people, not just my constituents, but people throughout Billings, that they don't want additional mandates. The discrepancy between the two hospitals and how they look at servicing the public, I guess is the best word to say, how, whenever you go into the hospital, what they do, what they don't do, they're different. Riverstone Health, anytime we ask John about it, he's going, I don't have anything to do with the hospitals. And then the masking, the science behind the masking, those are there's different opinions about it. and the type of mask that people wear, if they're any good, if they actually do good, if they do harm. So there's a lot of issues that people see the discrepancy in what they're being told. So I've said from the beginning, these are things that our moms always, they taught us at their knee. Wash your hands, stay home if you're sick, cover your coughs, and some of those things. So I understand the leadership aspect of what council is trying to do as far as having council members do, show the front, have put out a good front on this. And it's not to say that I don't do these things or I don't go in large crowds, because I pretty much am trying to do what I think is common sense. And I do limit myself. But I think once we start hammering the public, and that's the way I look at it, is hammering the public, you're going to find more resistance. So I don't know that I would be just jump on board myself personally. I'm just saying that's my opinion. And I probably am in the minority with this, and that's fine. I'll stand up to that. But I'm just saying that I think we have to be really careful. I know there are some people that really expect us to do this. And then there's others that are going, you're kidding me, because they're being told by so many agencies of what to do. And they are getting tired of it, just like John said, they are getting tired of it. So anyway, that's my 2 cents.
Okay, thank you, Councilmember Brown.
Councilman Perrington, I'm with you 100%. I agree with absolutely everything you said. However, I really don't want to see any more restrictions on businesses. Everybody thinks businesses are doing fine because they're not seeing a bunch of closed signs out there, but there are closed signs out there. And we're going to see more if we have to keep restricting this again. And, if we can spend, a fairly insignificant amount of money and just make it well known that, look, just do it. Whether you agree with it or not, for crying out loud, don't put our businesses out. And that's kind of the message for me, is not go put on a mask. Everybody's heard it a billion times. But now it's like, if this continues to climb, we're going to be restricted again, and your neighbors are going to be moving on. And that's my fear. And that's why I would support doing something.
Thank you very much. Councilor Bernice?
Thank you, Mayor. I agree with Councilman Brown on that. My concern now is that the number is going to climb to where we're going to start seeing businesses have to close and shut down like it first happened. And that I don't want to see. I know someone who had some contact with COVID, and of course they always wear a mask. And they're asking, well, why am I now being contacted? Or, I've always worn a mask. And I think there's so much misinformation about masks do not protect you. They protect the other people. And so there's a lot of people out there who don't wear masks, and somehow that they were involved and got near someone or contacted with that. And so that's how they get contacted. So I think my concern now is because as I watch the numbers daily, I open my browser, and the Riverstone Health website comes up, and I look at those numbers and review them, and I've been watching them for a long time, and you see them starting to climb. And John's message, he's the county health officer. He has the power to shut the businesses down, and he's given us warning that we've got 30 days to turn this around. And I really do not want to see businesses be shut down like they were. And so I don't know what an insignificant amount would be to run a campaign or to hire some things, but I sure would like to see us do something to at least get the word out that we have got to do something to kind of restrict the contact and get these numbers down.
Okay, thank you very much. Chris, I wonder if it'd be possible for, I guess our agenda has already been published for our meeting in 1 week. But maybe we can all agree to amend that agenda for at least an update from staff on what you found out if anything, between now and then. Would it be impossible for us to take action, or should we just amend the agenda so that potentially we could take more definitive action 1 week from now in the way of authorizing certain dollars? Or how would you suggest we proceed?
So, Mayor and Council, my first thought is this. I give you administrative report whenever we have a regular meeting. We'll have one of those next week. I can't imagine the dollar amount that we would be contributing would be beyond my authority to sign. So if I tell you what the number is and it's well within that authority, even though it might come with a budget amendment 2 months later, you'll remember that I said, hey, here's the number that I would be our share of the commitment. So I think I can do it during my administrative report next week, and that should be enough to make a decision as to how to partner with our other partners in this regard specifically. So that's my thought.
Okay. Does this sound like a plan for going forward? I see some thumbs up and but also some hands. So Councilmember Ewald.
Thank you, Mayor. What's the timeline we're talking about here?
I don't think anybody really knows, except that given the deadline to get the numbers down quickly, recognizing everything's 2 weeks behind, we're already kind of late.
Yeah, you got to start tomorrow. You can't wait 2 weeks, because 2 weeks you've already got the exponential factor coming in, and so it's going to close. People know what's going on out there. Now, the only way you're going to change it is you're going to stand on a street corner and start arresting people because they don't have masks on. That's not going to happen. We don't have any place to put them if we arrest them. They know what's going on. How are you going to change your mind? It's a tough situation, and some people are going to do it and some people aren't. And that's just the way it's going to be.
So, sorry, Mayor, if I might offer, the extremely great support we received from the public safety levy from 11 people with very different opinions is 11 people on that front agreed. And so maybe part of this message is this isn't about left, right. It's not about my political perspective. We don't want businesses to close down. We don't want churches and businesses to drop down to 25% capacity mandates. I frankly, professionally respect that John gave us a heads up that here's a target, there's clarity to it. Anything we can do to help, let's try to make a difference.
Yeah, and I'm hearing a majority commitment to communicate exactly that to our partners based on this conversation. Councilmember Tricky and then Ronnie, and then we should try to wrap up. We just broke the 9 o'clock witching hour.
Yeah, I see that Ms. Dahl is online. Hopefully she can actually, I know she did it in email, but maybe for the public and for the rest of us to hear, exactly what the legal aspects are and what we can do in order to enforce in this situation.
Okay. How long would that take? It's not really on our agenda, although it's certainly relevant to this. Chris and Gina, are you prepared to address that?
Sure. I believe in just a few minutes we can summarize the email that Gina sent out earlier today. It's pretty straightforward. It's not very complex. So Gina jumped on here. She's been waiting all night for this moment. So
yes, Gina,
gave me a smile,
please.
Oh no! I wonder if she's frozen.
Well, hopefully you can hear me.
We can hear you, Gina.
I've been having trouble with my internet all night, so I'm not sure that you can even hear me. Can you hear me?
We can see you.
Okay. So I guess I'm a little. I'm sorry. Can you hear me?
Yes.
Okay. I think you're all frozen. I'm not sure that you're hearing me or not, because I can't see or hear any of you. So unfortunately,
turn your video off. If you can hear us.
I'll try that.
Yeah, go ahead.
I could hear that.
Yeah, we can hear you great.
So, okay, good. I think the question was more specifically about how what the city can do to enforce the mask directive and the governor's mask directive. And I did send out an email earlier to you all to talk about that a bit. And generally, this public health order, which is the governor's directive, is really enforced by the county attorney or the county attorneys, any designees of the county attorney. It's this particular directive is more focused on businesses, which allows them to deny access or allows the businesses to deny access to people who don't wear masks. It's really more for the business to remove anyone not following the directive. If they don't follow the directive, if the business asks them to leave and they don't leave, then they can certainly call law enforcement, and law enforcement could respond, potentially charge them with trespassing. But the whole point is that really we're looking for compliance, not to be jamming people up with fines or things like that. So I guess as far as enforcement, I'm not exactly sure what the question is beyond that, but the mask directive is certainly to get compliance, not to, fine people or jail them.
Okay, so the city businesses always have the opportunity to call our police and ask for somebody to be removed because they are trespassing if they're there without the permission of the property owner. Thank you for that. We'll take a look at the memo. I haven't read that, but it's good to know it's out there. So we will take a look at that. Councilmember Ronning and then Councilmember Neese.
Thank you. I was just going to comment before Gina gave her presentation, and thank you, Gina, that showing a unified effort amongst all of the different groups that have been mentioned prior, I think really goes to defining community, and whether citizens in Billings have heard the information from all of the different news sources that we listen to. I think there's something really different that happens when there's unified communication from your own community. I think there's an embracement that happens that people are part of a community, and this is about saving our neighbors' lives and our families' lives, and making sure that our hospitals aren't overrun and making sure our businesses are open. And it's really about a community-wide effort, and that people are part of this community. And I think that really holds different value than just the multiple news information that comes at us in different capacities and in different ways. So I really do support this unified effort of messaging going forward. So thank you.
Thank you very much. Is there anything else before we... this is still council discussion, so we haven't had public comment on non-agenda items. We still need to open that up. Is there anything else on this item of council discussion? Again, to wrap up, I think staff has been given a clear message that we do want to participate, including financially, and we'll get more information on that. If there's a real emergency, then Chris, my expectation is that you would be prepared to make some sort of commitment as long as the dollar amount was not too great, is what I'm hearing. Okay, then if you've got the adequate direction there, anything else in the way of council discussion before public comment on non-agenda items? For anybody who's listening, be prepared to call that number 237-6196 if you'd like to comment on anything not on our agenda. We'll open it up for public comment then. Don't see any other council members jumping at the opportunity. So, Denise, do we have anybody who's called 237-6196? And we'll delay here to give people a chance. We are about a minute ahead, so please turn off your television or your computer and keep your comments to less than 3 minutes. We'll ask you to introduce yourself and tell us your address. If you call that number 237-6196 to comment on anything that was not on our agenda tonight. 237-6196.
Okay, Mayor, we do have a caller who's holding. This is Cecil Brown. He's at 447 Hillview Lane. I'll put him on now. Hello, Cecil.
Yep, I'm here.
There, very good. I've announced you, and you have 3 minutes to give us your comment, please.
Okay, thank you.
You're welcome. Go ahead, Cecil. Mr. Brown?
Yes, go ahead.
Go ahead.
Hello. Hi, my name's Cecil Brown. I live at 447 Hillview Lane. I'm a homeowner. I've lived here for the last 26 years, and I'm commenting on the Jackson Court Apartments, the proposed affordable housing project that they want to build just west on Jackson and north of Mitchell. And I live approximately 500 yards south of that area, 3 houses down from the proposed location. And I just want to say, I don't think we have the appropriate infrastructure in this area to add 38 units of affordable housing. That's what they're looking at. I've spoken with a lot of my neighbors, and we all agree that, that would be way too much for the lack of the infrastructure in this area. Maybe a couple of duplexes or 3 or 4 multiple housing units, but not 38. That seems to be quite high for this area that's underdeveloped. We have a ditch south of here that's not safe. Children could be walking through there. It's not a safe area to be walking. It's not developed. We don't have curb, gutter, and sidewalk. And in addition to that, I think if you would contact the Billings Police Department about another such low-income housing unit just east of Jackson that is probably one of the most crime-ridden areas of Billings. Almost on every night you can hear gunshots going off in that area. That is also low income, or what they would call affordable housing. So we're not looking to bring that kind of activity into our neighborhood. And if you speak to most of the neighbors on my street or any of the other streets around, you'll find that we are opposed to it. So we would hope that you would listen to our wishes. And it's not just about dollars. If you're thinking about bringing in affordable housing, let's do it without bringing in crime. Because you can get with the Billings Police Department, ask them what they feel about the other affordable income housing on East Jackson. And I think most of you might learn a thing or two.
Okay.
Thank you.
Thank you, Mr. Brown. Hello, and thank you for your call. You've reached the public comment period for tonight's City Council meeting. You will have 3 minutes in which to give us your comment. You may want to turn down your TV or place it on mute right now. May I have your name and address, please?
Sure. This is Michelle Williams with the Billings Depot, and the address is 2310 Montana Avenue.
Okay, Michelle, go ahead.
Hi, everyone. Mayor Cole, council members, and Chris, thank you for the time this evening. I am calling in on behalf of the business and property owners along Montana Avenue. I sent you all an email earlier today just updating you on some of the initiatives that we have going on within that corridor. So I thought I'd give you guys a call, summarize the information for you, and give you an opportunity to just ask some questions, and hopefully I can answer them and clarify things for you. So the business owners and property owners along Montana Avenue, what we realized is that we've been independently having meetings and conversations about specific topics related to issues specific to Montana area, such as transients, public safety, beautification of the area, traffic flow, crosswalks, things like that. So what we decided to do is create this new association of business and property owners where we can unify all of our conversations and then kind of unite behind these initiatives and try to push things forward as a group so that we're not duplicating efforts. So the first agenda item that we really wanted to come together on and tackle is this concept of traffic calming along Montana Avenue. And it really timed out well with the traffic study the city and Dow has been doing on the streets within downtown, converting some of them from one-way to two-way, and then also parking and bike lanes along Montana Avenue. So what I sent you today is a petition that was signed by the majority of business owners along Montana Avenue in favor of parking versus bike lanes. So Councilmember Tariki, I really appreciated your email conversation today, and I think you are absolutely right. I think as a group, we would be in favor of looking at the future of this corridor, promoting healthy living, getting out of the vehicles, as long as it doesn't take away from parking and traffic calming that is desperately needed right now. So if we have to pick one or the other, bike lanes or additional parking, the majority of business owners are in favor of adding parking to Montana Avenue and moving forward with that road diet, reducing the number of lanes from 3 to 2 and adding additional parking. If there is the ability to have additional parking and bike lanes, I think that would be fantastic as well.
Okay. Thank you.
Sure. Is there any questions that I can answer?
I think they may respond to you in your email.
Fantastic. Well, thank you for your time, everyone. Have a wonderful evening.
Thank you. Okay, Mayor, it looks like that's all of our callers for this evening.
Okay, we will close public comment on non-agenda items. Councilmember Brown, I saw your hand up before we adjourn.
Yeah, Chris, that Montana Avenue is not city street, right? I mean, we don't.
Sorry, Councilmember Brown, Mayor and Council, it is a state highway, so we do have to, and we have been working with them on the road diet plan, and we do need them to sign off on it.
Thank you. Okay, anything else before we adjourn? Good night, everyone, and stay safe and wear your mask, keep your distance, and wash your hands. We are adjourned.